Sweatlick,
Present.
Wallach,
Present.
Weaver,
Here.
Yates,
Here.
and Young.
Present.
Mayor, we have a quorum.
Excellent. Very good. And with that, I will turn to Sarah Huntley to walk us through the details of language interpretation for tonight. Sarah?
Good evening, Council. My name is Sarah Huntley. I'm the Director of Communication and Engagement for the City of Boulder. Because of the important public health safety information we have to share tonight, the city is making Spanish interpretation available. So I want to just spend a minute letting people know how they can choose their preferred channel. If you'll bear with me for just a moment, I'm going to share my screen to show a quick slide. Okay, can somebody give me a thumbs up if you can see the blue welcome to this Zoom meeting slide? Terrific. Okay, so we're going to encourage people to click on mute when not speaking to limit background noise, because we're essentially going to have some people in an English channel and some people in a Spanish channel this evening. The way you choose your language is by looking at your horizontal menu bar. It's usually a black or dark gray bar that stretches across the bottom of your screen. And you should see an icon that looks a little bit like a globe. If you click on that globe, it will give you a drop-down menu, and you can choose either EN for English or ES for Espanol. The interpretation will continue throughout the COVID briefing, and then we will resume to English only for the rest of the meeting. The mayor or I will try to announce when we make that switch. I do want to give a couple of tips for people who are maybe new to simultaneous interpretation. It's really helpful for our interpreters if you speak slowly and clearly pronounce your words. A good tip we like to use is to tell people to take a breath in between each sentence. Please don't interrupt the speaker. It's very challenging to interpret multiple voices at one time. If you own a headset with a microphone, it's very helpful for clarity for you to use it. We know we probably have some multi-talented individuals who can speak more than one language. It's easier for our interpreters if you choose the language that you're most comfortable in and stay in that language. And I would just encourage English speakers to avoid using some of the phrases and idioms that are familiar to us, but might be very challenging for somebody speaking another language, such as quit cold turkey, or be under the weather, or have something on your radar. Try to speak as clearly as you can using simple phrases. Now, because not everybody perhaps has understood this to be able to switch channels, we're going to pause for one moment so that Manuela Cifuentes, my colleague in the Language Access Program, can quickly do our 1 moment of consecutive interpretation. After that, we'll switch to the language that people have chosen.
Buenas noches, muchas gracias a todas las personas que están asistiendo a esta reunión del Consejo Municipal. Tenemos interpretación al español y para seleccionar interpretación tienen que ir a la parte baja de su pantalla y hacer clic en el icono que parece un globo terráqueo y escoger español. Y entonces van a poder escuchar la interpretación en español que durará lo que dure la presentación de COVID. Muchas gracias.
Very good.
Thank you. I think we're good to go, Sam.
Thank you, Sarah. Thank you, Manuela. Appreciate that. Our only order of business before we move on to our public health briefing is we need to amend the agenda to add a declaration honoring the Boulder Police Oversight Implementation Team. So if I could have a motion.
So moved.
Moved.
And a second. Anyone opposed to adding this item to our agenda? Seeing none, I think we are ready to move on to our COVID public health briefing. And here tonight with us, we have Jeff Zayak and others from Boulder County Public Health. I just wanted to mention before we get started, Jeff has been giving us these briefings once a month since last year. And this may be his last briefing to us because, Jeff, I believe that you are taking retirement at the end of the month. So thank you so much for all the hard work you put in, and we look forward to what you have to tell us tonight.
Thank you, Sam, and thanks, council members. And it's always been a pleasure to come here and talk to you and to see the dedication that you all have to helping improve this this whole disease progression. So it's been a pleasure. Thank you. I'm going to share my screen, and the information that I have to present tonight is good. Our data still can, I need screen sharing. Our data is
Bear with
good.
me, I can do that for you.
Thanks, Sarah.
Sarah, I think
our-
we've got the presentation for Jeff, if we can just pull it up.
I'm sorry, presentation computer has it, or we need to make Jeff be able to share?
Jeff, I assume it's the presentation that you guys turned in, which
Yes,
Taylor,
it
if you can
is.
pull that up.
Yeah. Either way is fine.
Taylor, can you please pull that up? Thank you.
Thank
There it
you
is.
so much. So overall, the presentation I'm going to give you tonight is good. I'm going to cover a couple things. I'm going to go over the latest data and what it looks like, and then I'm going to talk a little bit more about where we are with vaccinations, what we can expect moving forward, and then Dr. Indira Gujral is going to talk in much more detail about what we're doing to address some of the disparities that you're going to see in the data that you've also seen presented to you here in the past. Next slide. This is our metro data. As you can see, we've been declining. We do have a little bit of an uptick that you'll see when I checked the slides this afternoon. That did start to come back down. So we hope that that is a short-lived uptick right there that you see. Next slide. We are still yellow on the state dial. And as you can see, 2 of our 3 indicators are in blue. We're actually in day 6, I believe, of the incidence rate being in blue and our positivity being in blue. So we are headed toward a blue category. We will be waiting for the state to make contact with us once we are eligible, but our data again is headed all in the right direction. Next slide, please. This is our 7-day average number of cases. Again, this is going to be a common story. Good news, we're at 44.5, can certainly handle this number of cases much more readily than we could when we were up in the 100s. So all headed in the right direction. Next slide. This is the number of cases in the 18 to 22-year-olds. And then the orange line graph there is the percentage that account for CU students, and you can see that's at about 35%. We did have a downward trend over this last week, so that's a good sign as well. We are hearing some reports of parties on the Hill. We've been working closely with the University of Colorado, and thank you again to the City of Boulder folks who, especially Maris and her staff, who are really helping us ensure that we are following through on trying to do everything we can to make sure that we are keeping parties in check. We would not be able to be successful without the support of the city, so thanks to all of you. Next slide. This is the disparities, and our disparities increased in cases, and what it basically represents here, let me first describe this. That bottom line that's green, above that line, you would see a disparity, and below that line, a disparity doesn't exist. So what you see here is several different line graphs. The first one is case relative risk that's in dark blue. We still see disparities between our non-Hispanic white folks and our Hispanic folks, and that disparity, as you can see, has come down, but it is still a disparity that exists for us. The second one is relative to hospitalizations, and you can see that's come down, but it's also still above that green line, indicating a disparity exists. And the last one is death relative risk, which has come down and is a positive trend and is now below that green line. Next slide, please. This is the total number of tests per day. Again, this is one, I'll say this message once here and once at the end, but we have ample testing capacity. And again, thanks to the City of Boulder for supporting the Stasio site. I've really appreciated all the support from all of you to make that site easily accessible. We have free testing there. You can go to our website and find out testing dates and times for all of the sites across the county. We really need people to continue to test for 2 reasons. Number one, Again, 50% of the folks who are positive don't even realize they're positive. So we want people to know if they have the virus. You don't have to be symptomatic. You can get a free test at any of the, at several of our sites in Boulder County. And the second reason is a portion of those test results get submitted to CDPHE and are looked for the variant. So we want people to continue to test throughout this entire time that we are getting vaccinations out there, and until the time when we have herd immunity in our community, it's going to be important to continue to test. So please do take advantage of the free testing in Boulder County. Next slide, please. This is our hospitalizations. You would see the same trend for the state as well. Hospitalizations both locally and across the state are decreasing, although it's a slowing trend. You can see the line was fairly steep. And it has now tapered off a bit. So we want to continue to think about those prevention strategies like masking, maintaining social distancing as things open up more. Next slide. This is our deaths, also on a declining trend. And I'm going to talk more specifically about long-term care facilities in the next slide. Next one. So you can see here that our long-term care facilities, as you all know, have been a significant challenge for all of us. And it is not at the fault of the long-term care facilities. We had a lot of staff coming in that were asymptomatic late in the disease progression. And we knew that the best way to be able to help control this disease was to get vaccines to these facilities. And we have since seen a significant decline because vaccine has been provided to the facilities that are out there. And that's making a huge difference. Next slide. So this is from the Colorado School of Public Health, and it's from their report that's dated February 24th. And they ran several models. So this is a follow-up to the conversation or the models that I presented to you last month. And they've run several models, but the main model and the main thing I wanted to show here is that transmission control does make a difference as we move forward. It says vaccine 1, and I just want to make sure I'm clear on what that scenario means. So the scenario that's showing here is that 40% of Coloradans would have at least their first shot of vaccine by June 1st, 2021, and that there was 70% uptake in all the categories that had coverage. So that's the assumptions that are being modeled here. There's multiple other scenarios in the report, but I wanted to use this one just to show how much difference, again, transmission control can make. On the bottom of that slide, I don't know if it's just on my screen that's cut off or not, but there's a blue dotted line, and there's 3 different transmission control categories. The first one is 76% transmission control, which is where we are today. So if you remember last month when I presented to you, we were at 83%. We've come down in terms of transmission control from 83% last month to 76% this month. The projections that are there are 76%, 70%, and 60%. And the top line as a worst case scenario is that 60% scenario with the assumptions that are built into this model. So you can see in that we're approaching total active hospitalizations at the top on that top graph. The one on the bottom left is active ICU patients. You can see that we exceed that in this scenario with the most updated data this week and the projections that they've run. And then you can see, and this is where I think it's really important to focus, is the cumulative deaths. If we continue our transmission control at 76%, we're at that very bottom line that's dotted. So very little change in deaths. If we relax our strategies, we don't wear masks, we decide that we're going to get together in large groups, and the disease spreads before we have vaccination out, then we can expect to see more deaths and a significant more deaths in a low transmission like 60%. So it's an important message to just keep telling folks that the work that we've been doing to keep our transmission control high is critically important moving forward, and we just need to keep doing those things. Wear masks, social distance, don't gather in huge, large groups. If we can just do these things for a few more months, I'll talk a little bit in a second about what vaccine we might see in the months ahead, which is positive news. And if we can just get through these next several months, we are going to be in a much better space than where we've come from. So wanted to keep encouraging that. Next slide, please. So I think probably everybody's heard that phase 1B3 starts on March 5th. And there's more detailed data on our website and on the state's website about what each of these categories include in phase 1B3. But it's now people age 60 and older. It's frontline essential workers in grocery stores and agricultural. And when we're talking agricultural, it's things like JBS, meat packing. Think about the places where there's large congregate areas where there was lots of outbreaks early on in those scenarios. And then people 16 to 59 with 2 or more high-risk conditions. And again, the list of high-risk conditions is on our website and the state's website. Next slide. We've been doing really well on vaccinations. We've got almost 60,000 vaccinations to Boulder residents. And if you go to the next slide, we can look at what that looks like in the categories. And the ones I want to highlight are those bottom 2. We know that the older categories are going to have the greatest impact, which is why the governor started with those prioritizations. And you can see in that far right column, if you go all the way to the bottom, you'll see 51% and 84.2%. In the 51%, those are 65 to 69-year-olds who have had at least 1 vaccination at this point. And the 70-plus-year-olds are at 84.2% that have had at least 1 vaccination at this point. We are doing phenomenally well comparative to the rest of the metro area. And a lot of this is because we have incredible providers. We have 32 providers in our community that are doing incredible work. And they're really helping us get these vaccines out the door. We have capacity now for 20 to 25,000 vaccines per week. We're still getting only around 7 to 8,000. And we are building capacity to closer to 35,000 per week. So there's been a lot of work that's been happening with the anticipation that we are going to be receiving a significant amount more vaccine towards the end of March and the early part of April. You've probably seen some of those predictions on the national news. We keep hearing this from the state, and we do anticipate that we are going to receive more vaccine. Next slide, please. Regardless of the disparities that you saw in the previous slide, we still do have disparities in getting vaccine out. Indira is going to talk about this in more detail, but you can see in the white non-Hispanic space, population is 90.8%, but that population has received 93.5% of the vaccine. In the Hispanic, as an example, Latinx community, you can see the population is 5.3%, but they've only received 3% of that vaccine. That also is a disparity in our Asian and Pacific non-Hispanic population as well. So you can see there's still disparities that we need to address as we move forward. We have been planning and working with city partners across Boulder County. And again, Indira is going to talk some more about that. I'm almost to the end here. Next slide. This is again that metro graph that shows our 70+ % of our population overall in the metro. We've done 71.3% of the 70+, and Boulder County is leading the pack there with, as you saw on that previous slide, almost 85%. Next slide. We do have some persistent low vaccination areas. We've been looking at this map on a weekly basis. It's produced by Denver Public Health, and we've been using this map to look at where are the areas, and just to orient you, the dark red is better than the light. The lighter the color, it means there's less vaccination in that space. So the darker red means more vaccination, the lighter colors mean less vaccination. So we're using these maps to look at areas that we need to increase access to vaccines for, and using the map as a planning tool to be able to do that, not just for Boulder County, but also across the metro and with our hospitals. And I think I have one last slide, and then I'm going to turn it over to Indira. And that's just, again, you've seen me say this over and over, but don't let up on the prevention. We've been doing great work. We were at an estimated 1 in 230 some odd people last time I presented. We've dropped a little bit because of our transmission control going from 83 to where we currently are at 76%. So we want to make sure we are focusing and keeping ourselves moving forward by following those preventable steps down below of, again, wearing masks, washing hands, social distancing. And as I've mentioned before, if you haven't done it yet, if you go to addyourphone.com, the exposure app is great because if you are in close proximity to someone who is a known positive, you will receive instructions on what to do next and how to make sure you are protected yourself. And again, keep the hope up because there is light at the end of the tunnel. We have vaccines being distributed. They are increasing slowly, and we're going to see more as we move forward. So encourage folks to hang in there with us a little bit longer, and we're going to be back to a space that feels better to all of us. And I'll stop there and turn it over to Indira.
Thanks, Jeff. I'm not sure, Emily, if you have my slides.
Hey, Lauren, I think she does.
Okay, great. Oh, perfect. Thank you, Sarah. I just want to say first, before I get started about the vaccine update, that I'm really happy to see that the city of Boulder is going to be honoring those first cases on March 5th. And I just want to say thank you as a city of Boulder resident. That is something I do plan to participate in because I think it has been a long year and there has been a lot of loss. So thank you. Okay, well, I'm going to quickly go through just what's happening with the new phase distribution approach because it's created a little bit of confusion and I want to make sure that everybody understands what's happening in each phase. And then I'm going to share some equity strategies that we're working on across all of Boulder County, and that includes our municipalities, City of Boulder, City of Longmont, Lafayette, and others. Because we cannot do this alone and it's going to require all of us to work with our community partners. Next slide. So this is probably our fourth iteration of our phase distribution plan. The good news is that phase 1A, which was those highest risk healthcare workers and those long-term care facilities, those are completed. So that's great. We are about 85%, as Jeff presented today, done with our first doses of 70 plus. So that's a real good milestone to reach. And we're doing a great job in Boulder County. All of our enrolled providers, which include our 5 area hospitals, our King Supers and Safeways, everybody's pulling their weight. And as soon as those vaccines come in, they're getting out. And I couldn't be more proud to work with such a dedicated group of people. We're also doing a phenomenal job with all of our first responders and our moderate risk healthcare workers. We will be running our last clinic this week, and we should have wrapped up all of the moderate risk healthcare workers in Boulder County. So that's a lot to celebrate. On phase 1B.2, we're making tremendous progress. 51%, as Jeff presented, of those who are 65 to 69 in Boulder County have received their first vaccine. And I reached out to our education partners today, and they said that most, if not all, K through 12 teachers and frontline education partners, along with ECE, have had the opportunity to sign up and register for a first dose. So some of them are going to be looking at second doses quite soon. So that's very, very exciting. And I know that our schools were really eager and excited to get back to school. On March 5th, which is this Friday, we'll be entering into this phase 1B.3, which again, as Jeff said, opens that up to people who are 60 and older, those frontline essential workers in grocery and agriculture. And there are very kind of prescribed definitions of what this looks like. As Jeff said, go to the website. And then individuals who are 16 to 59 with 2 or more chronic conditions, and they have to be high-risk chronic conditions, will be offered the vaccine, and they will sign an attestation at, say, a doctor's office or wherever they're getting their vaccine from. What we know is for phase 1B.3, we're looking at an estimate. We looked at some of the estimates that the governor's provided. We think it's close to 58,000. If we extrapolate what those numbers look like, across the state, and we extrapolate to Boulder County, it's around 58,000 individuals that will be eligible in phase 1B3. And if you think about it, we get about 8,000 doses a week. So that's going to take us probably close to a month to get them all done. And hopefully with the J&J vaccine coming on board and we see more allotments there, we'll be able to get more people vaccinated. And then phase 1B.4 in April, I'm going to talk about just a little bit more, but that is close to 2.5 million individuals in Colorado, which is estimated around about 151,000 people in Boulder County. Next slide, please. So this is just an explanation of that 1B.3 prioritization list that's going to go into effect on Friday. And it just has a lot more information about, who actually qualifies. Next slide. And here's the estimate for the whole state. It's almost 1 million people that fall into this 1B.3 estimated number. And we estimate, that we represent around 6% of the population. So close to, 58 to 60,000 people. Next slide, please. And then this is 1B.4, and this is actually a very long list of prioritization. So it then opens up, and this is the one that starts in April. So people ages 50 and older, those who are student-facing higher education faculty and staff. So that will impact our CU community, where their faculty and staff will be able to get vaccinated. And the good news is that CU has built the infrastructure to be able to handle, like as a closed system, to be able to handle their own faculty and staff with their vaccinations. So that's great. Then we also have frontline essential workers in food and restaurant services, essential workers in manufacturing, postal service. Next slide, please. Public transit, public health, human service workers. So a lot of what we have fielded lately is questions from the human service partners who are definitely on the front lines. And unfortunately, this has pushed them back into that April vaccination date. This also includes faith leaders and people who are providing direct care for anyone who's experiencing homelessness. So anyone who is serving the unhoused population. Next slide, please. It includes journalists. And one thing that they have added is the continuity of local government. So we'll have to learn more a little bit on that. Continuity of state government. And then anyone who received a placebo during the COVID trials will be offered the vaccination, along with people who have one or more high-risk condition who are the ages of 16 to 49. So as you can imagine, this 1B.4 is a very large group of people. And we are hearing that that large group of people will open up and that we will also be receiving a lot more vaccine allotments, as Jeff said. So that should coincide nicely with us being able to get people vaccinated as fast as we can. Next slide, please. Again, there's that 2.5 million people. Next slide, please. And then the general public actually is that phase 2. So they did away with phase 3 and now they just have phase 2. So I'm happy to answer questions after I finish my presentation, but there are a lot of changes and I do encourage everyone to take a look at the State Health Department's website on the new phase prioritization. Next slide, please. Next slide. So I'm going to talk a little bit about our vaccination strategies. So most of the vaccination strategies where we've been serving the most amount of people are around these traditional clinics. So that's where someone has the ability, they are a community member that has the ability to operate IT, a computer, they have Wi-Fi, they have the ability to sign up with their phone or their computer and drive themselves to go and get a vaccine. And for the majority of the public, these are this traditional clinic of going to a hospital or a clinic or a pharmacy is what most people use. But what we have realized in looking at all of our data, and we knew this going into before the vaccinations became available, is that there are some groups within the population that one may not have the ability to be mobile. So these might be individuals who have limited mobility and are homebound due to health conditions. And so we do have one of our big equity clinics is around mobile clinics. And right now we're focusing on people who live in independent living. So if you remember, I think I shared a few months back that people who live in long-term care or assisted living, that they were getting vaccinated through that long-term care partnership by CVS and Walgreens. But there are people who live within those same residential communities who live in independent living, and they unfortunately did not qualify to be vaccinated. So, but there are many that have some mobility issues. So we have been working really closely with our housing partners to make sure that individuals in living, independent living, and individuals who are homebound, and individuals living up in the mountain communities, that is one of our priority population groups, and we're targeting them using mobile clinics, which are usually fewer doses than 250. The second equity-based strategy that we're using is a community clinic, where it's 250 doses or more. These are considered long-term and sustainable. And our goal with these is to take those areas that Jeff presented and use the data where we're seeing less uptake, particularly among certain neighborhoods, and making sure that we create community clinics that are available within those neighborhoods to ensure that people have access to the vaccine. But it's not just access. Next slide. It's not just access to the vaccine that's important. It's also addressing vaccine hesitancy. And so on the right there, we have Dr. Sheila Davis, and you've probably seen her on TV. She is our health equity educator. She's also what we call CDPHE, or State Health Department Vaccine Champion. And so Sheila is actually working across the state and across regionally and locally here to really talk about vaccine education. So she's been doing this through a series of town halls. And Lizbeth Mendoza is also supporting these. They're doing them in English and Spanish. And what they're doing is creating the space for people to ask questions who might have questions about the vaccines. So that addressing that hesitancy is kind of our long-term goal. We also have the clinics that we're running, the mobile clinics, and then of course our community clinics there. And we have different partners from across the county because we need everyone, because this is a big, heavy lift. So we need all partners to support us. Next slide, please. So I believe I shared with you at the last City Council meeting about our equity strategies. Our overarching goal is to eliminate vaccination disparities so that everyone has equal access and equal opportunity and feels comfort in being able to receive the vaccine. As I said, our long-term goal is to address vaccine hesitancy, and we need to leverage our trusted community partners to do this. So, you know, it's one thing to be a government institution and say, yes, you should trust me. But the reality is that people do trust their community partners and their community members. And so we're operationalizing our equity strategies through shared leadership, which means that we are empowering community to help determine where do we set up clinics, who do they trust as trusted partners, and how should we do this with the community members to get people to feel comfort in getting the vaccine. Next slide, please. And some of the survey results that were done prior to the vaccine show that the willingness to be vaccinated, this was done of about 1,000 people back last fall before the vaccines were even available. But we knew that the willingness to be vaccinated varied by race, ethnicity, and gender. In particular, women in particular are less likely to have trust in the vaccine as compared to men. And we see this across both with African Americans and the Latinx community, where some of it is almost down to 50%. And the one caller, Boulder, Boulder provided a similar survey that they did locally, and their LGBT survey did show almost the same, very similar results with this same kind of gender variation. Next slide, please. So this brings us to our vaccine equity strategy flow. So the first thing that we have to do is to address vaccine and improve vaccine confidence among all populations across Boulder County to ensure that people know that it is a safe and effective vaccine. And this includes addressing vaccine concerns, rumors, and myths, raising awareness of the availability and letting people know where they can go in order to get vaccines. In addition to that, we have what's called the Vaccine Equity Coordination, where we are working together with a group that we're calling our community ambassadors. So these are individuals who are in the established community who support vaccinations and are being trained to be able to answer questions and support the community with questions, along with our city partners, our vaccine managers, and individuals such as, our health systems who provide the vaccine. And our goal is to make these vaccine connections. And our vaccine connection is really to develop a system to identify people to register for vaccines and providing clinics that are available in native languages, culturally responsive, and make sure that languages are available. And then the last column represents the 3 strategies of vaccine distribution, which I discussed before. Next slide, please. Right now, we're currently working on our vaccine equity connection. It starts with strong communication, leveraging our influencer groups, which include our cultural brokers, our diverse community connectors to schools, and which schools have a very strong influence in the community. And then also making sure that these community ambassadors are connecting with cultural brokers to work together to leverage and get the word out about where vaccines can be made available, answer questions, and help people get registered either through a traditional vaccine source or through one of the community clinics that are being set up, or through a mobile clinic. Next slide, please. And this just describes the difference between the ambassadors and the influencers, with the ambassadors having actual training in vaccine safety and effectiveness. And that's really important because you could ask anyone like, hey, Sam Weaver, what do you think about vaccines? And Sam's going to tell you what he thinks about vaccines, but Sam may not have training in safety and effectiveness of vaccines. And so part of the community ambassador group is to make sure that we have a central point for training, and that has to be ongoing training because the vaccines are always shifting. We're adding new vaccines. And of course, the phase distribution is always shifting. So we're adding different people into different groups. And so part of that is to centralize that information in community ambassadors. Next slide, please. Right now, the Boulder County Public Health Call Center, it does help individuals with limited IT and English proficiency get registered. So if you know of someone that wants to get registered at Kaiser Permanente or Safeway or King Soopers, give the call center a call and they can help connect you and get them registered. You don't have to have a computer. You might have to have a phone. A landline is fine too. Next slide, please. And I just want to reiterate and end today by just saying what Jeff has said. It really is going to take all of us to continue doing what we need to do. So socially distancing, masking, making sure that we're not gathering with groups, and keeping everybody safe so that we can get our virus levels and our case counts down to a suppressive level. Thank you.
Great. Thank you, Indira, and thank you, Jeff. Jeff, are there any more folks that you would like to have present tonight?
No, that's it. We do have Dr. Bina on the line as well for questions, if there's any.
Super. Thanks very much. Thanks to both of you so much for the information. Super helpful. Council members, looking for any questions you might have?
Sam,
Adam.
I'm missing a raise hand function, so I'll just do it the manual way.
Okay, great.
So I'm not sure who to direct this towards, maybe Urbina, but I noticed that there is a vaccination tier for people who are frontline workers helping people experiencing homelessness, but I noticed that there isn't a tier at all for people just experiencing homelessness. And I realize that you guys aren't setting the tiers themselves as to who needs a vaccine before one another, but I was just wondering if you have any information about, since people experiencing homelessness tend to have more health issues in general, and we've been hearing that anecdotally people aren't going to shelter because they're worried about catching COVID within a shelter where there's many more people in a congregated environment. Is there any reason given why that wasn't a tier itself and why that doesn't deserve advanced vaccination?
Indira, do you want to take that? Or do you want me to take it?
Yeah, it is a really important question, and it's unfortunate that we cannot go in and vaccinate every shelter, individuals who are unhoused. It definitely goes against our public health values. What I can tell you is that people who are meeting the criteria for 2 or more chronic conditions or are in those age groups, that we can go in and vaccinate them. And we are exploring about what the Johnson & Johnson rollout will look like, because that is a 1 dose and that it might be a little bit easier to navigate. So we are not only looking at using that methodology for individuals who are unhoused and the staff that serve them, but also potentially for the jail and other areas where we feel that those congregate settings might make them at much greater risk for COVID. Jeff, anything to add?
No, just that the only other thing I would add is that, as you've probably seen, Adam, there's been a few recommendations and requests to the governor's office, but he has turned those down at this point. So
Thanks, I appreciate that from both of you. I totally understand you're not making the decision as to who gets them, but just was wondering about the background there. And thanks for the follow-up answers. Obviously, I think that's a little bit short-sighted and not helpful, since people experiencing homelessness tend to have even more health issues, and it'd be better, I think, for the whole community if we were being proactive. But yeah, any pull you have there with the governor, you can pass that along from me.
Great, thanks, Adam. Rachel?
Yeah, thanks to Adam for bringing that question up and advocating for us to use whatever advocacy power we have to tip the vaccine rollout in ways that are more equitable and to people who are vulnerable. And I just wanted to follow up on the Johnson & Johnson vaccine that someone mentioned, and that maybe that would roll out more easily to people in 1 dose. And I read a little bit of like pros and cons on, the efficacy rate is not as high, and I don't want to open a can of worms with worrying people around that, because I understand it is still very high, but just wanted to maybe give the opportunity for you all to describe that vaccine and why people should take it if it's the one offered. I personally plan to take it if that's the one. Should I ever be lucky enough to have a number called up for a vaccine, I will take the one offered, but just wanted to give an opportunity to speak to that, if anyone's interested.
Chris, do you want to take that, or Indira?
Yeah.
Sure, I'm happy to start with this and certainly join in Indira. As you know, there are 3 available vaccines that have all been emergency use authorization. The 2 vaccines that you've heard most about, Moderna and Pfizer, have shown to be 94, 95% effective, reducing moderate to severe disease, and likely to be protective against passing the infection, although those studies aren't actually done. The newest vaccine, the Johnson & Johnson vaccine, is a totally different platform. It's an adenovirus viral vector platform, which has been shown to be safe as well and highly effective. The good news about as you already alluded to, Rachel, is that it's a 1 dose vaccine. and it's been shown effective around the entire world, which I think is tremendous because it's been exposed to people who have gotten the vaccine as well as the placebo have been exposed to the multiple variants out there, the Brazilian variant, the South African variant, as well as the predominant strain currently, as well as B1.117, which is the UK variant. So that bodes well for the one-dose vaccine because it's been tested and people have been exposed to those multiple variants. And so when you talk about decreasing effectiveness, it's because it's been exposed to multiple variants. And that is a good sign. Being that effective and the estimates are anywhere between 75 and 80% effective against moderate to severe disease, death, and hospitalization, which is a very good effectiveness. So you can't compare vaccines and say, well, this one is better than that one because it was tested on a different population and still highly effective against all those variants. So keep that in mind. And it's also one dose, which I think is also good. People, as Indira alluded to earlier, people, particularly people living with homelessness, are hard to follow. They would not come in for a second dose, maybe. And although I support Adam's concern about getting those folks vaccinated, one dose vaccine will help work with them. Still, as Jeff alluded to, I'll stop there and just see if there are any follow-up questions about that, Rachel.
Okay, very good. Thank you, Rachel. Thank you, Chris. Next, we have Mary and then Bob. Mary?
Thank you, Sam. Thank you, Jeff and Indira and Dr. Urbina for being here with us again tonight. And Jeff, congratulations on your retirement. My question, I'm going to follow up a little bit on the Johnson & Johnson vaccine, which has already, my question has already been partially answered. But another feature of the Johnson & Johnson vaccine is that the refrigeration requirements are a lot less stringent than the other two vaccines. So I'm wondering what kinds of changes in your equity strategies that particular vaccine will have, if any.
I'm going to leave that for Indira if she's still there. If she knows more about our vaccine equity rollout.
Indira?
I'm sorry.
Perfect. There you go.
I'm sorry, Mary. I missed the last minute of that. I have kids. Okay.
No worries. I understand. My the short question is, what kinds of changes in strategies, especially where equity is concerned, are planned with the Johnson & Johnson vaccine coming on board? And
yeah, I think that's a really good question. With the Johnson & Johnson, part of what we have to do is learn about the vaccine in terms of being able to see the emergency use authorization and the recommendations that come from ACIP. So they'll give some recommendations about what priority populations we might want to, focus on with the one dose. It's definitely very appealing for populations that are a little bit more transient and may not be able to get back to that second dose, or you may lose them, lost a follow-up for a second dose, just because we know that the effectiveness for that one dose seems to be much higher than if you just give someone a Pfizer or a Moderna one dose, where the effectiveness is not going to be as high. That is something that we are exploring as we learn more about the vaccine. But yes, we would like to apply it for our equity-based strategies and figure out which populations might be best to address and make sure that they get the vaccine and accessible, make it easy and accessible.
Thank you, Indira. My next question is about any kinds of, so obviously we've been struggling with the whole pandemic over the last whole year, and we've learned a lot, and a lot of things have surfaced in terms of just how our society works or doesn't work. And so I'm wondering what kinds of long-term changes are being planned as we move forward and out of this pandemic.
Jeff, do you want me to talk a little bit? Yeah. So I do think that this systems and the structure that we're setting up for addressing these equity-based strategies for vaccinations could be a long-term approach to handling disparities of all kinds, not just of related to COVID, but any type of health outcome. Pre-pandemic, when you look at health outcomes and risks and behaviors and factors like smoking and things like that, you can see disparities that exist across the whole community. And so the question is, can we use this type of approach where it's very community driven and where community is helping to solve problems and ensuring to help create trust to get people to doing things like doing vaccines? Is that a long-term sustainable approach that can help us post-pandemic with addressing larger disparities that we might see?
Hey, Mary, I could add just a little bit to that too. So I think that the county is focused on developing an Office of Equity and I'm sorry, I can't remember the exact name of it, but it's an office that's focused on equity. And one of the things that we are learning from what's happened with this pandemic that I know is being carried forward is to really look at what does community engagement at a different level mean, and a lot of the things that we're learning from the surveys, from the interactions with our cultural brokers, from the folks who serve these communities, is that we need to make sure that when we approach our communities, that our communities are deeply involved in what that approach looks like. So we are taking some of those lessons forward, not just from COVID, but to carry on into other things as we move forward in the county.
Thank you both, Indira and Jeff. Appreciate that. And then my final question is, Indira, you mentioned in your strategies that you're going out into the county and mountain communities and addressing people who are homebound. And I'm wondering how you find the people in mountain communities who are homebound.
Yeah, so it's a really good question. And, we know that we hear that there are estimates of up to 3,000 individuals in the county that are homebound. But when we work with we have to actually work with partners who work with individuals who are homebound, and then ask them to help us, put people in touch with us who might want to be vaccinated. So there's two questions there, so a partner might be, it's Harvest of Hope is a good example. They have a mobile clinic where they serve people who are homebound, where they deliver food, right? So they're a local community-based organization. And they reached out and said, we do this mobile clinic and we serve people who have mobility issues and can't get to us. And so we said, okay, well, if you have people that are interested in getting vaccinated, let us know. And then we can, and if they're of this criteria of a certain age, and all this is changing, of course, but we can get them vaccinated. And so they become a key partner in helping to say to their clientele that they serve, hey, if any of you are interested in being vaccinated because of your mobility issues, will come to you. And so that's kind of how we're working, is just leveraging the partnerships that exist. I also heard that the state health department and the governor's office, I think with this recent phase distribution plan, did put something out in the news about working to support people who are homebound. But right now our focus is we have about 70 more people who are living in independent living. And once they're done, we're working on homebound. Now, I will tell you that in talking to Boulder Community Health, they have, existing individuals within their system who are homebound, and they know who they are. And so they're actually putting out a team to go and actually get them vaccinated on their own. And so, we work in partnership with all of our enrolled providers because that's what it's going to take. It's going to take all of us, working collaboratively. But we just want to make sure that those individuals have the ability to get vaccinated.
Thank you. That's all I have.
Thank you, Mary. Next, we have Bob and Mark. Bob?
Well, first, I just want to thank Jeff for his cool and dispassionate presentation of information over the last year. I think you helped many people in our community become informed, not become unhinged or panic. And I just really like your dispassionate presentation of the facts, but your passionate pleas that we we comply with the health orders. And I think, Jeff, you deserve credit for saving lives in our community. So I really want to thank you for everything you've done in your years of service to the community and for all the times you've shared your wisdom with us here on City Council. So that's the first thing I want to say. I want to thank you very much, Jeff. I have a question for Indira probably, and this relates to how folks sign up for vaccinations. And I know we talked about this at your presentation last month, and it kind of seemed to be in a little bit similar situation. And this is probably nothing the Boulder County Health can do much about, but I just wanted to, again, flag it. You know, if we go to the Boulder County Health website, you guys have very helpfully provided a list of 10 vaccination providers in the county. 8 of them are kind of health folks like Boulder County Community Health and Kaiser and Clinica and Centura, and with links to how to sign up with those organizations. And then also you've got 2 pharmacies, King Soopers and Safeway. Yet when people go to these facilities, they get, or these links, they get one of 2 responses generally. One is, thanks, we'll get back to you. And then with King Soopers and Safeway, the answer is there's no vaccines available. And I guess the question really is there, what's the strategy for people if they now have become eligible because they're 65 or they're 60 or they're and then one of the categories, do they just go and sign up at all of these places and then just grab the first vaccine that becomes available? Or what do we tell people? It would be really great if there was one portal and people could sign up at one place, but it seems like there's not. There's like 10 places and you just keep shopping and keep shopping and keep shopping and sign up for a lot, which seems like a pretty inefficient system. And the risk, of course, is that you end up with multiple appointments and you only need one provider for 2 shots, and then you're going to end up canceling stuff. Is there any plan to do a central portal or any way for folks to sign up in just one place and then wait for the next available shot?
Yeah, we have heard this, over and over from the community, and it's really hard because every enrolled provider does have their own centralized system. I know that Chris Campbell, who is our emergency manager, is actually looking into this to see if if there is a system that will be able to support people just being able to sign up once rather than having to go shopping for, for anybody who can get them registered. So that is being explored, and we do have a group that's meeting weekly. And so hopefully we'll have some more information to come back to Chris Meshuk in our agency administrator meeting. I don't know, Jeff, if you have anything, or Chris, anything to add?
I would just say that it was brought up today at our agency administrator meeting, and we are bringing it back to the Thursday conversation. One of the challenges that I think I've shared before with all of you, but I can't remember for sure, is that we have independent distributions occurring from the federal government directly to providers. We have distributions from the state that goes to centralized ordering for some of our large health systems, and then they distribute from their centralized location to certain locations. So that's been part of the challenges in terms of trying to coordinate. And again, it's why we meet weekly with all of our 32 providers to try to understand what vaccines they're getting, what they're looking at in terms of distribution of those vaccines. And we're trying to coordinate in the interim from that perspective so that we're linked together and know what's happening in our community.
Well, thanks, guys. And hopefully you'll have some good news to deliver in the next few weeks as you kind of try to work on this coordination as we move from hundreds of thousands of vaccinations in our state to millions. I think we're going to have to come up with some centralized systems. And if you guys can figure this out, you'll be heroes for a lot of residents, I'm sure. Thanks.
Thank you, Bob. Mark?
Yeah, I want to start also by thanking Jeff. You've been a calm voice of reason during the past year. Your presentations have always been clear and informative, and you've done this community a great service. I'm sorry we're not going to have you presenting again. I look forward to the day when presentations themselves will not be necessary. But while they are, yours were terrific and very helpful, and I thank you. I want to further what Bob said. That was really the question I was going to ask. The Times this week did an article on the difficulties seniors and those who are not IT competent were facing in New York in order to get registered. And many people were actually just giving up unless they could get somebody with greater competence to get them registered. On the theory that this is not the last pandemic that we may see in our lifetimes, I would hope it is, but it may well not be. I think it's extremely important not to have this kind of balkanized system where you're going to 10 or 12 providers. I went to 4 or 5 before I got lucky. And that is just crazy. I understand that the logistics are difficult, but as a public health matter, I think we really need a centralized one-stop shopping system for people to sign up, get in the queue, and using whatever algorithms you need to use, get their appointment in as short a period of time as possible. So I would really urge you to put great efforts towards that, because we need it now and we're going to need it again in the future. And the system that we have is I really don't think is adequate for the needs of the community going forward. So thank you.
Thanks, Mark. I see Chris Urbina has his hand up. Chris?
Yeah, to Bob and to, let me lower my hand, to Bob and to Mark. These are very important comments, but I wanted to share with you one important piece that I think people forget in this whole process. If the providers had all the available vaccine that they needed to schedule those appointments, we wouldn't really have this system, whether or not we had a centralized system or not. Then everybody could go to their provider, or could come to the health department, or could go to wherever they wanted to go because that vaccine was available. Because of the shortage, it creates this huge bottleneck that the providers can't really schedule an appointment unless they have the vaccine. So I just wanted to point that out. We don't want to lose sight of that. Yes, it would be great to have a centralized system. Yes, it would be great that we had it clearly lined up, but without vaccine, we're stuck with this, and we forget that that's really the holdup with this. And I hear your concerns, but as that vaccine becomes available, then we won't really have a challenge with getting people signed up. Just keep that in mind.
Just to throw in a last comment, my concern, Chris, is as much with the future as today. And I'm not sure when the next pandemic arises that we will have no bottleneck again, because it takes time to develop a vaccine. It takes time to produce a vaccine. And there's always going to be a startup period, and not having a better way of getting people registered and getting vaccines allotted to the individuals who need it the most in the order of priority is likely to occur again, and it's critical.
Agreed. And I think if we put more support into public health and prevention, clearly we would be a lot further along. And so as you vote for that, the passage going on, hopefully we put money into prevention and public health so we can fix the better system, waiting for the next pandemic to occur.
Chris, you're preaching to the choir.
And Indira, I see your hand up as well.
Yeah, no, I just wanted to say thank you to Mark. I think Chris is right. It's going to probably take a lot of resources for us to move in this direction, and it probably will take a lot of commitment. So I do think in the future, when opportunities come up to invest in IT systems, such as one like this, please consider and remember the pandemic. I also wanted just to mention that the city of Boulder in particular is doing incredibly well with their 70 and over. There are many census tracts, and we can share the Denver Public Health census-based approach where they show you the data. But there are many census tracts in the city of Boulder where there are 100% of individuals who are 70 and older who have been vaccinated. In fact, I think I was looking at it this afternoon, one of your lowest vaccination rates may be in the 70%. So I just want to reiterate that a lot of people have been able to navigate the systems that they that have been put out. And it is unfortunate just due to what Chris said, that just the number of doses hasn't been available. And with the way that the system that has come from the feds to the state to the local level, that has not given a lot of our healthcare hospitals and enrolled providers the ability to plan as much as they want. So they're doing also their best within the system that's been given to them. So just wanted to keep that in mind. I want to celebrate because I think we're doing a really good job and we just need to keep it going. But I hear you. We need resources. Thank you.
Thank you, Indira. I don't see any more hands up from council members. Oh, Indira, is that a new hand? No, gone away. Very good. I don't see any more questions here. So I will once again thank all of you, Jeff, Indira, Chris, for being here. Jeff, enjoy your retirement. We really do appreciate the time you've shared with us. So thank you very much. And with that, I think we're ready to move on. We have a couple of declarations. We will start with one presented by Councilmember Brockett.
Very good. All right. So I'll be reading a declaration about Rare Disease Day, which just happened on February 28th. So this announcement is a little retroactive, but we didn't have a meeting right on the 28th. So please join with me in listening to this important declaration. So there are nearly 7,000 diseases and conditions considered rare, each affecting fewer than 200,000 Americans in the United States, according to the National Institutes of Health. While each of these diseases may affect a small number of people, rare diseases as a group affect almost 30 million, or 1 in 10 Americans. Many rare diseases are serious and debilitating conditions that have a significant impact on the lives of those affected. While more than 450 drugs and biologics have been approved for the treatment of rare diseases, according to the Food and Drug Administration, 90% of the known rare diseases are still without FDA-approved treatments. As such, millions of Americans still have rare diseases for which there is no approved treatment. Individuals and families affected by rare diseases often experience additional difficulties, such as diagnosis delay, difficulty finding a medical expert, and lack of access to treatments or ancillary services. While the public is familiar with some rare diseases, many patients and families affected by less widely known rare diseases bear a large share of the burden of funding research and raising public awareness to support the search for treatments. So the National Organization for Rare Disorders organized a nationwide observance of Rare Disease Day on February 28, 2021. And we, the City Council of the City of Boulder, Colorado, declare February 28, 2021 as Rare Disease Day and urge all community members to take cognizance of this event and hope that you participated fittingly in its observance. And I also mentioned that we lit the band shell in honor of the day in the colors of Rare Disease Day. And we have Lindsay Kane here, who I'm very grateful for making the request to council for this declaration, who can share a few words with us and also tell us about the beautiful house was also lit up in.
Yes, thank you. First and foremost, I would like to thank the council for inviting me to speak tonight on behalf of the rare disease community and for their support in recognizing the 28th of February as Rare Disease Day in Boulder, Colorado. I'd also like to express my appreciation to Anna Salim of the Downtown Boulder Partnership, Natalie Schranz of the Boulder County Commissioner's Office, and to Chef Hosea and Lauren Rosenberg of the nonprofit organization Sophie's Neighborhood for helping me to amplify this message. It is truly an honor. As Erin said, my name is Lindsay Kane, and in December 2019, I was diagnosed with superior mesenteric artery syndrome, a rare disease affecting as few as 0.13% of the population. Despite the challenges that came with that diagnosis, I soon learned how fortunate I was to have been accurately diagnosed within just 24 hours of first experiencing symptoms. According to the Timothy Syndrome Alliance, for many rare diseases, an accurate diagnosis can take 5 to 15 years, with 40% of patients being misdiagnosed. For me, the journey started with a diagnosis, but for many, getting the right diagnosis is a journey itself. That's one reason why spreading awareness is so important to the rare community, to let others know that having a rare disease isn't just dealing with symptoms of that disease, but also the struggle to receive a proper diagnosis, find information, and get access to treatments. It's the struggle of trying to find care, only to realize that there are few, if any, specialists that treat, and that you yourself are often the expert in the room for your own condition. But where there is struggle, there too is hope. Hope that by spreading awareness, more people will become engaged with the rare community and will be inspired to use their resources to help others find and develop treatments or even cures for rare diseases. With community support like that, which we have received through Boulder's participation in Light Up for Rare and tonight's Rare Disease Day declaration, we can and will lift one another up to raise awareness and save lives. Thank you.
Great. Thank you very much, Lindsay, and thank you, Aaron, for reading the declaration. And then I would just like to make a quick announcement that language interpretation services ended with the COVID public health briefing. So with that, we will also move on to one more declaration tonight that will be presented by Councilmember Young.
Thank you, Sam. This is a declaration in honor of the Boulder Police Oversight Implementation Team's service to the Boulder community. March 2nd, 2021. On February 2nd, 2021, the Boulder City Council approved the appointment of the first 9 members of Boulder's new all-civilian police oversight panel. This would not have been possible without the dedicated work of the Police Oversight Task Force and Implementation Team, specifically Todd Conklin, Jr., Michelle Dene, Madeline Woodley, Sean Ray Pasalacqua, Michelle Simpson, and Pam Gignac. Their collective efforts resulted in the development and passage of Ordinance 8430 establishing the Police Oversight Panel. In March of 2019, the Zaid Atkinson incident captured local and national attention, bringing the issues of policing and racial equity to the forefront right here in Boulder. City Council quickly convened a community meeting to discuss how the Boulder community could move forward with more robust transparency and accountability for police operations. Council subsequently convened the Police Oversight Task Force in May 2019 to assist in developing options for Council to consider. Based on the task force's research, analysis, and final report, Council adopted an initial ordinance in October of 2019 directing the establishment of a hybrid model to include an independent monitor and an all-civilian panel. In addition, Council also established the Police Oversight Implementation Team, which was composed of existing task force members joined by city staff to focus on finalizing the implementation details for the new model and passing the final police oversight ordinance. The implementation team began meeting in early 2020 and included Mr. Conklin, Ms. Dene, Ms. Woodley, Mr. Pasalacqua, Ms. Simpson, and Ms. Gignac. These 6 individuals jumped into work with passion and seriousness of purpose. They brought different life experiences and perspectives to the discussion, each with their own strengths and each of them contributing to the difficult work necessary to build Boulder's police oversight institutions. While developing the oversight model, they had to process their own trauma, as well as the community's trauma. They were creative, persistent, and not afraid to break new ground. They developed an inclusive and thorough hiring process for the independent monitor and then worked with the new monitor to finalize the police oversight ordinance for ultimate adoption by the council in November 2020. Upon adoption of the final ordinance, the implementation team then transitioned into the selection committee to interview and select the initial 9 members of the police oversight panel. The team invited local nonprofit organizations to provide representatives to be a part of the selection committee, further broadening the team's representation by incorporating individuals from Boulder County's Islamic Center and NAACP into the selection committee. This committee then reviewed all 53 applications that were submitted and interviewed a total of 18 applicants before selecting the panel's first 9 members. The Police Oversight Panel held its first meeting. The Police Oversight held its first meeting on February 11th, 2021, and their work is now actively underway. We thank the original implementation team, as they have come to be known for their passion, their intellect, their grit, and their desire to build an institution that improves the provision of public safety for everyone. While the effort to ensure and maintain constitutional policing can never end, the efforts of Mr. Conklin, Ms. Dene, Ms. Woodley, Mr. Pasalacqua, Ms. Simpson, and Ms. Jignac have produced a venue, a sustainable institution, which allows and even requires community involvement in police accountability and provides public transparency into police policy and disciplinary process. We, the City Council of City of Boulder, Colorado, declare our city's appreciation to the implementation team for engaging in this extensive and difficult work and for building an institution that will carry their values and spirit forward long into the future. Thank you all.
Great. Thank you very much, Mary, and thanks very much to the Police Oversight Implementation Team. I see Aaron and then Rachel. Aaron?
Yeah, Mary, thanks for that declaration. Really appreciate you bringing that forward. And just as the person who, along with Mary, that helped select that initial implementation panel, I'm just so grateful to everyone involved. It took an extraordinary amount of time and so much effort and wisdom and intelligence. And so just very grateful. Thank you all for your work.
Thank you, Aaron. Rachel?
Yeah, I wanted to thank the implementation team too, and Mary as well, and also wanted to kind of take it back maybe another year before that and thank the community members who showed up at the council meeting asking for the creation of an oversight panel. There was a lot of community input on the front end that I think led to this happening. And so just want to thank people who got involved early and used their voices to help us get to this good outcome. So thanks.
Thank you, Rachel. Okay, very good. With that, we'll move on to open comment. And before we go there, I thought I would turn to Sarah Huntley and see if Sarah could present the ground rules again.
Good evening, Council, again. I just wanted to let folks know who are signed up to do open comment this evening that we do have a few ground rules, and I also wanted to explain how the mute-unmute function will work. Unfortunately, I can't get my slides to project at the moment, so I'm just going to cover the ground rules quickly in a verbal format. So the important thing to know if you are providing testimony tonight is that Council provides testimony through audio for these meetings. Your video will not be turned on. Your name will appear when you're speaking and everyone will be able to hear your comments. What will happen is the mayor will call your name in the order in which you're on the speaking list. And I need just a second to toggle a switch that allows you to mute and unmute yourself. You should be able to see a mute or unmute button show up as soon as I've toggled that switch. And we ask that you unmute. You are asked to speak for the allotted time only. And for open comment, that is 2 minutes per person. I believe for the public hearings tonight, we have a short list. So I believe that will be 3 minutes per person. Sam's nodding that I'm correct on that. Once we get near the end of your time, the mayor will ask you to quickly wrap up if you're in mid-sentence, and then we will turn you off and go to the next speaker to make sure that we are providing equitable access this evening. We do ask that people use their full names. There's a couple of people who entered the meeting under initials, and I have tried to reach you in the chat box. I will need you to send me your full name if you're in here on initials in the Q&A box, so I can rename you and it makes it easier for the mayor to call on you. No pseudonyms will be allowed this evening. I think that's the basics, Sam. If you want to go ahead, we can start calling on individuals.
Very good. And I just have one more short announcement. This will represent the first open comment over Zoom, where speakers who are confirmed have the opportunity to show presentations to council. So from here on out, if you are confirmed as an open comment speaker, you can send any slides that you would like shown where you speak to this email address, cityclerkoffice@bouldercolorado.gov. And with that, I think we are ready to call people. We have a couple speakers who have withdrawn tonight, so we will start with Lisa Larn, Hillary Griffith, and Mark George. Lisa?
Bear with me for one moment while I find Lisa. I am not seeing Lisa Larn in the meeting this evening, Sam. Lisa, if you are in this meeting, it's possible you're in the meeting under a different name, and that's challenging for me to determine as the facilitator. So I want to invite you to respond to me in the Q&A box and let me know that you are in fact here and tell me what name you're under, and we will circle back to you. I do see Hillary Griffith in the meeting, so I think we should go on to her for the time being.
Perfect.
You should be able to unmute, Hillary.
There, can you hear me okay?
We can.
Okay, good. Well, members of council, thank you for your time. I'm here to encourage City Council to call up the Planning Board's decision about 891 12th Street, otherwise known as the Marpa House. There were many irregularities in the handling of this use review, and I feel it's important that council weigh in on a project of such immense significance to the community. For the last 18 months, our neighborhood has been organizing, collaborating, and working to protect this important structure, which is to be converted from a quiet co-housing unit to 16 likely undergraduate apartments. In anticipation of the planning board's meeting, the neighborhood submitted over 300 pages of letters about risks of this project. During their first meeting, it seems the planning board recognized these concerns. The majority of members stated in an informal poll that they would oppose the use review. However, in an atypical move, city council or city staff rather interjected before a decision was made and encouraged the planning board to consider approving the project with conditions which city staff would compile. Not only was this irregular for staff to interject in advance of a no vote, the procedure cut off public comment entirely. The developer could discuss conditions for approval with staff, but the neighborhood, the people actually affected by these conditions, couldn't communicate with the board at all. Put differently, the conditions for approval were meant to ease the worries of the neighborhood, but with staff's procedure, they were given no voice as to what those conditions would be. As a member of the community, one who is a native of this community, I can tell you that people feel dejected and silenced by this atypical handling of the use review. So I urge council to call up the planning board's decision about 891 12th Street, the Marpa House, to evaluate the merits of this project and to help all those who have been silenced to now feel heard. So thank you for your time. And if you would like, you can reach out to me anytime.
Thank you, Hillary. Next, we have Mark George, Sue Ellen Harrison, and Barbara Apple. Mark?
You should be able to unmute, Mark.
Yeah, I'm here. Yeah, this is Mark George, and I'm going to actually have my wife speak for me. Thank you.
It's already started. Can you go back to start? Hi, this is Donna George. I live at 4661 Tally Ho Court. As stated on agenda packet page 210 of the December 15, 2021 Boulder City Council meeting about the 2020 Boulder Valley Comp Plan midterm update, it says, based on direction from the Planning Board and City Council about the future of the sub-community planning program for Boulder in 2019, staff proposed multiple revisions and additions to the sub-community area planning descriptions. The full document detailing these changes was not available to the public until the December meetings of the Planning Board and City Council when they voted on the Boulder Valley Comp Plan 2020 midterm update. These detailed listings of deleted and added text to the subcommunity and area planning chapter were not present in the preliminary meetings agenda packets concerning this midterm update. So the citizenry did not get this information until these final meetings during a very busy holiday time of year for most people. I thought, since both incorporated and unincorporated land parcels are present in these subcommunities, especially in Gumboro, where the majority of the residents live in unincorporated Boulder County, that the county would be able to vote on these changes concerning subcommunity and area planning. In the subcommunity area planning chapter, it specifically states that Boulder County is involved in the developmental plans that affect land in Area 2 or Area 3. Since these are parcels, there are parcels in various subcommunities that are both in Area 2 and in Area 3, then the county should have a vote on these numerous changes in the text of the subcommunity and area planning chapter. Some of the new language that was added is the Boulder Valley Comprehensive Plan describes the city's core values, principles, and policies to be implemented across Boulder, and potentially included in the scope or change related to the newly adopted plans are changes to the city's comprehensive plan, land use regulation, and capital improvements program. I thought the Boulder Valley Comp Plan was a jointly adopted plan for both the county and the city of Boulder, not just a city comprehensive plan to implement city principles and policies.
Thank you, Donna. Thank you.
Oh my God, you're kidding, I'm done?
You're done, Donna. Thank you very much. We appreciate your comments. Next, we have Sue Ellen Harrison, Barbara Apple, and Connie Brenton. Sue Ellen?
Can you hear me?
We can.
We can.
Thank you. My name is Sue Ellen Harrison. I live at 840 12th Street. I'm also here to encourage council to call up the planning board decision on Marpa House. Decisions of this magnitude should be made by city council, not by an appointed board. We elect you to make the hard decisions, and due to the potential for huge changes to the character of our neighborhood, the proposed development should be called up for your consideration and ultimately denied. It also is not just because this is a major decision, but because there were numerous failures in the process. There are due process and procedural errors, there are factual errors, and decision-making that occurred without adequate information. Examples include the occupancy level and parking. You're going to receive emails from the neighborhood about all these failures. I know you'll take the time to read them. But for instance, on the parking, just to give you an idea of the problem, Planning Board approved 12 parking permits for Marpa for the proposed development. But there's no indication how they interact with the NPP parking program on the 800 block. There's no explanation as for whether Marpa House gets any permits, 1 permit, 16 permits. We don't know whether we're going to get 4 more cars, 12 more cars, or 64 more cars. So the kind of clarification we need. Presently, there are no apartment buildings south of Euclid, let alone south of Aurora, and that alone should give you pause. One planning board member even stated that it just doesn't belong here. Proposal clearly does not meet the city's criteria for approval. Other than a Rule 106 action, you are the only recourse the neighborhood has to address the errors and make the appropriate determination for the Marpa House. Thank you for your time.
Thank you, Sue Ellen. Next, we have Barbara Apple, Connie Brenton, and Tamar Larson. Barbara?
Yes, hello, thank you. We have seen firsthand what having no consequences leads to. Individuals committing crimes on the fly, laughing at the face of police when they arrest them. In the past year or so, we have seen our community trashed. Downtown parks, the creek, are littered with needles, feces, and garbage. Citizens gripe on Nextdoor that their homes were broken into again, and that their bikes were stolen from their garages again, and nothing is being done about it. Kids at Boulder High are being harassed, offered street drugs, and accosted right outside of the school property. As a teacher, I recently had to evacuate an RTD bus with 40 fourth graders because a man who appeared to be on meth rattled his pockets and said he had bullets in one pocket and a gun in the other. He proceeded to repeat that he was going to effing blow our heads off. Walking by the municipal building, we were approached by individuals who also appeared to be on meth. The students asked me questions like, "Aren't drugs illegal?" Isn't it illegal to litter? At the new park outside of the library, we had to leave 5 minutes after our arrival when 2 of my students found 2 separate needles, one of which was covered with dry blood and still had drugs inside of it. It literally could have killed him. I have pages of incidents of things that have happened to my family, students, friends, and colleagues. I know parents that no longer take their kids to the park. I know many people in Boulder that no longer will even go downtown at all, which, as a Boulder native, is a very sad statement. How are we allowing this to happen in our community? No consequences has led to more brazen crimes. Many of the victims of these crimes are poor people or people of color. I know of a woman who lives in a trailer park who had her bike stolen. That was her only way to get to work. She didn't have the luxury of saying, it's just stuff. I can go get another. This woman couldn't afford to buy another bike. These crimes are life-altering for people who are living in poverty, who are trying to work hard to feed their families. Maybe a car theft is just a cute petty crime for those with money, but it could mean an entire paycheck to someone who works a minimum wage job. Thank you.
Thank you, Barbara. Next, we have Connie Brenton, Tamar Larson, and Lopa van der Mersch. Connie?
Hi, I'm Connie Brenton. I was born and raised in Boulder, and I've owned Art Mart on the Pearl Street Mall for over 30 years. I'm here to say that the Pearl Street Mall is becoming an increasingly dangerous place. A year ago, we were burglarized. The police found the perpetrator in the building. He went to jail for 8 hours or so and then was released, even though being a self-professed sex offender. It is significantly worse now than it was a year ago. We were burglarized again 2 weeks ago, along with 2 other downtown businesses. Another business was burglarized twice last week. My staff, who are primarily young women attending Colorado University, have been both verbally and physically assaulted. They don't feel safe. They aren't safe. The perpetrators at Art Mart have been arrested and released multiple times. We know them by name. There are no meaningful consequences or deterrents, and thus it continues. Pretty much all the merchants up and down the Pearl Street Mall have suffered the same experiences. Area businesses are closing at an alarming rate. I've heard from many Boulder residents, they no longer will shop downtown because of safety concerns. We will lose our tourists next. Repeat criminals must be kept off the streets. We need regular police presence, security cameras, no electricity on the poles outside the courthouse. I have personally reached out to this council many times, sending very disturbing videos, and I have had limited or no response. The city council must address the crime and public safety in our community now. Failure to act thus far has nearly destroyed the Pearl Street Mall and areas in Boulder. We can't afford to keep looking the other way. Something horrific is going to happen, and you, as a council, will carry blame.
Thank you, Connie. Next, we have Tamar Larson, Lopa van der Mersch, and Patrick Murphy. Tamar?
Hi, can you guys hear me?
We can.
Okay, great, thank you. My name is Tamar Larson, and I live at 920 10th Street. I've actually lived in this very house off and on since 1994. Regarding the Marpa House, I see a really negative change in this lower Chautauqua Upper Hill area as it becomes more permissive of high density student housing. There's a whole bunch of things I want to say, but I better condense this. The applicant, the developer, did not integrate the concerns of the neighborhood. And we've been voicing these concerns since the fall of 2019, starting with grassroots conversations in a local park. We've contributed our considerable communal energy by writing letters, by showing up at numerous city council meetings and in person and via Zoom. I ask that you please hear us and not allow high density student housing to be developed and built in our neighborhood to change the entire timbre of the neighborhood. The city values this beautiful local neighborhood as a desirable place to live. Our neighborhood is a quiet, peaceful, and lovely place. And as it becomes more undergraduate focused in terms of student housing, there is an increase in noise throughout the day and night, broken glass on the sidewalks, loud music, and this is such a huge problem. affecting the quality of life for those of us in this neighborhood. I'll actually consider selling my house if this high density development is approved, because it clears the way for future ones in this neighborhood, as the quality of life is clearly affected. I know of 5 other homeowners who are also considering selling their homes in this neighborhood because of this particular development. And this just reflects the frustration that we're experiencing. And I ask you to hear us and to value all of the meetings and notes and showing upness that we've all done. At the city council meeting right now, you have the ability to profoundly affect the quality of life that we get to experience here. So I ask you to please listen to all that we've written and submitted regarding the particular development of the Marpa House into a high density place. Thank you so much.
Thank you, Tamar. Next, we have Lopa Vandermersch, Patrick Murphy, and Ellen Morris. Lopa?
You should be able to unmute now.
Can you hear me?
We can.
Great. Hi, my name is Lopa. I am a mom of 2 young boys and an entrepreneur with a business here in Boulder that employs 18 people. Like many moms, I'm on several Facebook mom groups, and uncanny timing, I woke up this morning to a Facebook post asking in a mom's group about what it's like to live on the hill with children. And there were 23 comments on this post. Only 4 were positive, and each of those said specifically that there are certain areas where it is lovely and feels safe to live, but there are many that are not. I have some choice quotes for you guys. One said, "To be brutally honest, it was a nightmare. Our final straw was a college kid high on acid, naked in our front yard, screaming and trying to break into our house at 10 p.m. on a Tuesday, and then being tased by the cops. We were looking for new homes the next day." Another said, "One day I found myself vacuuming my yard in order to clean the glass so my daughters wouldn't cut themselves after someone stole a light fixture from another house and threw it on our steps. There was also a day when a drunk 20-something peed on our front bushes in the middle of my daughter's 5th birthday party, exposing himself to a bunch of kids. It was 10:30 a.m., but it was game day." Another said, "Coming from a 2-time CU grad, I loved the Hill when I was in my undergrad. I love that area so much, the history, the architecture, but I did not enjoy living next to the frat house party scene. My car got vandalized twice and the noise is all hours of the night. They're not just the weekends. There are some parts with mature residents that would be lovely, but I would not recommend the bopping college parts as a mom with a young kid for your own sanity. This project, the Marpa House project, is ultimately proposing turning one of those lovely, quiet, family-friendly areas into one of the more of the bopping college parts. The idea that this is going to be good for the fabric of Boulder feels profoundly unfounded and smacks of the kind of short-sighted capitalist opportunism that quite honestly is Boulder and most of humanity at its worst, but definitely not at its best. And Boulder, we have so much best to give. Can we do better? I know we can.
Thank you, Lopa. Next, we have Patrick Murphy, Ellen Morris, and Alexia Parks. Patrick, I believe you also have a presentation.
My name is Patrick Murphy. I live in Boulder. Red Cross has clearly stated that the devastation of climate change far exceeds the devastation of COVID. Time is of the essence in both cases, but if you miss the fact that climate change is actually more important, next slide, you forgot the smoke warnings of last summer. Next slide. The last presentation, you skipped one. The last presentation was a path to quick carbon reduction using wind incentives. This presentation provides a path to fast carbon reduction using solar. Next slide. Rooftop solar may not be the absolute cheapest path, but it has the least environmental impact of all alternatives. Only about 1 in 7 rooftops are appropriate for solar, but huge industrial roofs are also available in Boulder. These incentives are obviously for the middle and high income, so only a fraction of the available resources should be dedicated to this. Remember, I got solar for no cost and a lease rate that saved a few dollars a month going through Tesla. I did this 10 years ago without a muni. Next slide. One of the best options for Boulder would be Xcel's Renewables Connect. It's a subscription with a waiting list, and we should be on that list. Boulder is currently collecting over $7 million annually in carbon taxes. Next slide. It's worth noting that to cover all of Boulder's current non-renewable electric usage would cost us $4.6 million to be 100% renewables today. The cost would be less if we estimate the renewables Xcel will be putting on the system over time. Any one of these alternatives could have us at 100% renewables today. It'll be a mix of solutions that get us to our goals fast. Start with LED streetlights like all our neighboring towns did years ago, and an LED giveaway to lower income homes. The planet burns, floods, and dies. Are we just fiddling? Thank you.
Thank you, Patrick. Next, we have Ellen Morris, Alexia Parks, and Val Kendron. Ellen?
Hello, can you hear me?
Yep.
Thank you for this opportunity. My name is Ellen Morris and we live at 875 11th Street, 1 block from the Marpa House. I offer the following points for consideration that were overlooked by the planning board and the city staff. As such, I request that the city council call up the planning board's decision. The neighbors and community members are mobilized to unanimously oppose the student housing proposal under a non-conforming use review. Despite the fact that there are 300 pages of comments and robust community engagement, the planning board did not consider any of these concerns and instead rubber stamped the owner's plan. At the last meeting, they seemed to listen to the various viewpoints, but at the end of the day, the planning board did not require any changes. This in light of the fact that they knew that the owner had paid people $100 each to speak on his behalf. This has not been a transparent or fair-minded process. I'm highlighting 3 points of many, but I urge you to review the large body of input opposing this project as is. 1, the property owner and his team made no effort to consider the range of reasonable concerns that have been articulated by community members. The plans in the building configuration have not been modified at all regarding use, tenant behavior, parking, noise, and traffic. The Marpa House is a quiet area with mainly single-family homes, and without changes, it will significantly affect everyone's quality of life. This should not be approved as student housing, but rather could be designed for families and people working in Boulder. If it is approved as a student dormitory, then an on-site house manager should be required. This was not made mandatory by the planning board, but it is clearly necessary to monitor behavior and assure accountability. 3, enforcement of noise and garbage complaints will be up to the neighbors, which already does not work. The monthly revenue on this property will be at $70,000 to $80,000, so the typical fine will have no impact and nothing will be done by the property owner. To ensure compliance, there should be a combination of very high fines and rental license forfeiture. Bottom line, during a use review, it is the job of the planning board to work towards decreasing nonconformity by requiring a plan to be more conforming. Therefore, I request that the city council
Thank you, Ellen. Thank you. We appreciate your comments. Next, we have Alexia Parks, Val Kendron, and Stefan Vandermersch. Alexia?
Hi there. My name is Alexia Parks, and I live at 973 5th Street. And I've lived on the hill since 1965. I have lived next door to students, and now I live in a family-friendly section of the hill. I too am here to strongly encourage City Council to review the planning board's decision about 891 12th Street, which we all know, many of us know as the Marpa House. This is a massively important project to the neighborhood and to Boulder as a whole. I just want to remind you, it's not an exaggeration to say that if it is approved as is, it will forever change the lower Chautauqua neighborhood and not, I repeat, not for the better. Think noise, think traffic, think litter. Noise, traffic, and litter. Think firecracks at 3 a.m. in the morning just for fun, and it wakes us up. And we do work. I still work, even at my age, as a senior. It's no surprise that community members wrote over 300 pages of letters to the planning board to impress how significant this use review really is. A project of such importance, in my opinion, deserves council review, and I think I'm not alone. I know I'm not alone in this, especially given how strangely this case was handled by the planning board, and others have mentioned this before me. My request, please call up the planning board's decision about 891 12th Street for review at your next meeting, and we'll all be there to cheer you on. Thank you.
Thank you, Alexia. Next, we have Val Kendron, Stefan Vandermersch, and Mark Meyer, and I believe Val has a presentation.
You don't have to put up my presentation, but that's all right. Okay, this is regarding Marpa House. My name is Valerie Kindgren at 1212 Cascade Avenue. I've owned that home for 30 years and I'm a Boulder native. And we've noticed that over the last 3 to 4 years in our neighborhood, it's been increasingly and adversely affected as far as number and frequency of loud and boisterous groups walking, running, skateboarding up and down our streets from about, 10 p.m. to 5 a.m. And because of this, we are exhausted and we feel we are at a boiling point. This truly negatively impacts the historic nature of this neighborhood and the ability of us full-time residents to bond with each other and form a sense of community. Yes, we call the police, but they can't do much. They do their best. I knock on doors asking the tenants of rentals to please be quiet and ask the late night groups to please be quiet. And quite frankly, it's getting dangerous for me to do that. I've worked with Sergeant Tom Dowd and the university, but they can't respond to everyone disturbing the peace. They just can't do it. These are our homes. We live here. We take pride in ownership. The tenants use the rentals as temporary housing and then move on unaware or uncaring of the havoc they've created. And even if there are conditions in their leases, please don't be fooled. They do not care, and there is no fear of eviction. Sometimes we feel like we are being terrorized, especially by the fireworks recently. It's like an epidemic. And with the addition of 45 more tenants at 891 12th, the shenanigans will only increase. There's only one reason for the applicant to be asking for the special use permit, and that is money. So if passed, he will line his pockets at the expense of our peace, but we shouldn't have to be the victims from the behavior of these tenants. Again, something needs to be done. We need to tip the scales back to a peaceful place so that the proposed project has no greater impact to our neighborhood than the Marpa House had. And approving the special use permit is a step in the wrong direction. So I implore you to please call up the planning board decision. I appreciate your time and hope we have all been heard. Thank you.
Thank you, Val. Next, we have Stefan Vandermersch, Mark Meyer, and Diana Gonzalez-Burden. Stefan?
My name is Stefan Vandermersch. Council members, thank you for your 2 minutes for me and for your hundreds or thousands of hours of service to our city. I grew up in this city and I'm raising my 2 young boys here. I would like to share with you some information I feel is important for you to consider. I live next to Marpa House in 891 12th Street. What has happened with Marpa House is anything but an ordinary course of business in Boulder. The Daily Camera chronicled with extensive documentation of the developer's emails and voicemails how he lied to Marpa residents in order to collect information to outbid them for their own home. This is in line with his past behavior. This was not the first negative article about the developer in the Daily Camera. The developer served ill time in recent years for contempt of court in a civil case where he was accused of fraud and for which he was ordered to pay a 6-digit settlement just down the street from our city council building. The developer employed a private investigator to collect information on neighbors and has targeted individual neighbors for intimidation, as well as made threats to the neighborhood as a whole. At the last planning board meeting on Marpa House, there was a hot mic moment where a speaker in favor of the project, a few moments after her public comment, said to someone else seemingly in the room with her, quote, "I did my thing. I earned my $100, end quote. People were paid to speak in favor of this project. Nonetheless, in a spate of procedural errors, decision made based on inaccurate data presented by the developer, unusual moments of staff and board confusion and exhaustion as the meeting stretched on to midnight, and ignoring the massive neighborhood pushback against this project, Planning Board approved this project with no meaningful protections for the neighborhood. A community of 30 quiet Buddhists living together being changed to 48 student bedrooms spread across 16 apartments is going to be a devastating change for our neighborhood, especially in the hands of a developer that we cannot feel we can trust without any rules to keep him in line. I find this outcome at odds with common sense and code, vastly increasing nonconformity and the product of a process that went haywire. We are counting on you to review this decision and reverse it. Thank you.
Thank you, Stefan. Next, we have Mark Meyer, Diana Gonzalez-Burden, and Evan Ravitz. Mark?
Good evening, council members. Thank you for the opportunity. My name is Mark Meyer. I reside at 1177 Cascade just at the south end of the block from 891 12th Street. I'll be brief. I'm asking you to call up the planning board decision on 891 12th at your next meeting on the 16th. I sent you a letter earlier this week, over the weekend, and there were a number of issues and process problems with the application that you heard already from people far more eloquent than me. So I won't go through them here, but it's important that you're not influenced by the 7-0 vote of the planning board. The issues in question related to this case and to the overall policy of the city warrant a further public hearing. I recognize this is a challenge for you given all the time constraints on council's time, but you need to hear firsthand in detail specifics on the gaps in the use permit, which unduly impact the neighbors with little or no enforcement teeth. Excuse me. Further, the broader public interest in the process issues need discussion, where the most impacted community was not allowed to comment on the conditions being proposed once the planning board decided to continue its meeting. At the end of the day, the goal is to find a solution that works for everyone, but that limits the impact to the neighbors and the overall character of the neighborhood. The planned use as approved by the planning board is completely opposite from what has been the use at that location for decades, and certainly for the 22+ years that I've lived at my present address. Please call this matter up for further review and discussion for the good of the neighborhood and for the good of the city of Boulder at large. Thank you.
Thank you, Mark. Next, we have Diana Gonzalez-Burden, Evan Ravitz, and Brian Travis. Diana?
Good evening. My name is Diana Gonzalez-Burden, and I live across the street from the Marpa House. I encourage you to call up the planning board decision regarding Marpa and reverse the approval. Call up is appropriate because the neighbors in the area, as you've heard from many already, universally oppose the conversion of the Marpa House into 16 3-bedroom apartments catering to undergrad students, which is what the planning board approved. To understand the extent of the neighborhood's opposition alluded to by others, the city council need only review 2 documents. One is a summary of the 300 pages of comments submitted by neighbors to the planning board staff through October 2020. And 2, the January 2021 consolidated neighborhood comments to the planning board signed by about 127 neighbors. These documents are in the planning board record, and I submitted them to you in an email today. The applicant has indicated that this property is a multi-generational investment, which means that the neighbors will have to live with the decision of the city for decades or move out of the neighborhood. The city council is the elected body that should make such a significant and far-reaching decision. Other reasons you should call up this matter and reverse include the planning board and staff made numerous factual, legal, and procedural errors in approving the project and establishing conditions. An example is the occupancy as Marpa House. Staff and planning board assumed 50 occupants based on the rental license. In fact, the number was at most 36 and submitted. The neighbors will detail this in written comments and the errors. Allowing a 48-student apartment in this neighborhood changed the character of the neighborhood. Importantly, the proposed student housing would represent an increase in the nonconformity of the use as compared to the quiet contemplative use of the Marpa House for the last 43 years. Without city council action to call this up, the other recourse is judicial review. Thank you.
Diana. Thank you. Our last 3 speakers are Evan Ravitz, Brian Travis, and Rachel McKee. Evan?
Hi. Sam asked us to honor the people who got Boulder ready for COVID. I'd like to thank the No Eviction Without Representation ballot initiative folks, the Bedrooms Are for People ballot initiative folks, and our working group that got online petitioning for ballot initiatives. Too bad the city delayed the last 2 by a year. Something is wrong when 8 city department heads leave their jobs in 20 months. The police chief, the transportation director, the facilities director, the city spokesman, the city clerk, the city IT director, and the top two, the city manager and soon the city attorney. One reason, Boulder has long gotten by on looks and public relations. In the late 90s, the longest playing city council member, Spence Havlick, said on camera here, "Truth is not so important as people's perception of it." Elegantly phrased, and he lived up to it, deceiving me and the public. But he skated. Not anymore. Young people who hate deceit and hypocrisy are more active than since the 60s. The reason for deceit is simple. The city pretends to represent us, but like everywhere in the US, according to the famous Princeton, Gillens, and Page study, you represent the wealthy while putting on a show about community and equity. State Representative Edie Hooten told me she consults with stakeholders, the factions the founding fathers warned us of. Stakeholders appear nowhere in the Colorado Constitution, unlike constituents who appear dozens of times. In the Boulder City Charter, stakeholders appear once, describing a member of the Downtown Management Commission. Voters appear dozens of times, but are treated as a nuisance to be snow jobbed. Thus our need for ballot initiatives so we can fix the sorry ship of state ourselves. Thank you.
Thank you, Evan. Next, we have Brian Travis and Rachel McKee. Brian?
Hi, everybody. Thanks for having me. My name is Brian, and I live in the downtown Whittier neighborhood, where crime has been pretty out of control recently. At the recent January 19th meeting, a few members on council that opposed the camping ban suggested with their comments that some of the citizens may be uncomfortable or intolerant towards the unhoused community. I thought these comments were somewhat offensive and dismissive of the concerns being expressed by the community, and I wanted to share a few reasons why I'm uncomfortable. The stabbing incident next to Boulder High this January and the murder by the Dairy Arts Center made me uncomfortable. It makes me uncomfortable that 0.03% of Boulder's population unhoused committed 37% of the serious crime in Boulder in 2020, not including 39 felony menacing incidents. It made me uncomfortable last fall when a man, apparently burglarizing our neighborhood, walked by our house with a butcher knife. Fortunately, I saw him just as my teenage daughter was heading out the door, and I was able to have her remain inside until he was gone. It made me uncomfortable last Tuesday night when we had police all over our neighborhood looking for a man with a machete. This man had threatened a neighbor a few blocks away from our home. From the officer's report, quote, "The male pulled a large 2-foot long machete from his backpack and told the victim he was going to chop him into little bits." So I think based on the data that Chief Harold presented on the 19th and my own experience, it's pretty reasonable to feel uncomfortable. We have an addiction and a violent crime problem among a small subset of the unhoused, which are unfortunately our housing first policies don't address. So as we debate a broader strategy, I beg you, please focus on efforts to get violent, repeat criminal offenders off the streets. Our neighbors being terrorized, please help. We can have
Thank you, Brian. I'm sorry, Brian, your time is up. We appreciate your comments. If you'd like to email the rest of them to us, try council@bouldercolorado.gov. Thank you very much. And our final speaker tonight is Rachel McKee.
It looks like Rachel McKee was in the meeting. I attempted to allow her to unmute herself and now she's out of the meeting. So I don't know if she hit the wrong button. Oh, here she's back in again. Let me give it a try. Are you there?
I'm here.
Terrific.
Hi, thanks. Sorry about that. I've got a little bit of unstable internet, I guess. So yeah, thank you guys for taking the time to listen to all of us tonight. I too am calling in to request that you call up the planning board's decision about 891 12th, also called Marpa House. I live 2 blocks from the development and have been very engaged with the process since the first meeting with the developer in the fall of 2019. And despite numerous opportunities to integrate and make changes based on the community's feedback, the project is largely the same as when it was first proposed. I'm a little concerned that this case might be being viewed as like the neighbors versus the developer or neighbors versus students, but we're not anti-student or anti-development. We really just want the development to move closer to conforming use and to integrate some of the 300 pages of concerns and requests that the neighborhood took the time to send the planning board. The approval of a planning board, even with the few stipulations that they put in place, doesn't meet the use review criteria. And those stipulations are really almost impossible to enforce. They don't integrate some of the most important neighborhood requests, like designing the development for more than only a student demographic to reflect the neighborhood, having an on-site manager like the building as a fraternity or large-scale student housing would have originally had, and making sure that the property is being treated as one entity for violations. So again, like a single property would have been dealt with historically. So this is a large development. It'll have significant impact on its surroundings. A 48-person apartment building in a quiet residential zone of mostly single family homes and long-term residences is a big, big development and a big impact. Again, this project really moves the property further away from conforming use of the building, not closer. So we really need City Council to step in and help get this development more aligned with zoning, character, and the tone of the neighborhood. Thanks for your time. Please do consider calling up the planning board's decision. Thanks again, guys.
Thank you, Rachel. And with that, we will bring open comment to a close, and I will turn now to city staff. Chris, do you have any comments about what we heard tonight?
Nothing for me tonight.
Thank you. Tom?
Nothing for me, Sam. Thank you.
Very good. And I see a few hands, Bob and Aaron. Bob?
Thanks, Sam. I think my question is for either Chris or the chief of police if she's on. We heard from several community members who are concerned about crime downtown and near downtown in the civic area. I know that we talked about this at the January 19th meeting, and I believe we're scheduled to talk about it again in a few weeks. But Chris, I'm wondering if you could let us know, or maybe the chief, what steps have been taken recently to ensure that the police have all the resources that they need to address crime in that area. I think we all realize that the jail is largely closed to receiving many people that otherwise would have been arrested, but for COVID. So I think we all kind of can bookmark that part of it. But setting that aside, can you talk a little bit about what steps have been taken in recent weeks to ensure that the police have the resources that they need?
Sure, Bob, I can answer that. And Maris is not in the meeting right now, but there was another incident downtown early Saturday morning, and both Maris and her team, as well as Yvette and her team, have been engaged with the downtown business community to start to look at other ways that we can address things. In addition, Chief Harold has mentioned that she has met with the sheriff. She has also begun directed patrols downtown, and we're continuing to talk through. I'd be happy to have both of them here maybe on the March 16th meeting if council would like a more in-depth briefing of some of the steps that we're taking to try and address the concerns of what's happening downtown.
Well, I can't speak for my council colleagues. I would welcome that if that's the will of council. I know we're scheduled to speak about this at the end of April, but it does seem like we have a more immediate concern. And if there's anything that you or the chief needs from council, either tonight or if you want to wait till the 16th when the chief's on, that's fine too. But it sounds like we've just got a pretty dire situation there. So I would say I'll just speak for myself, to the extent that you or the chief needs anything from council, please ask for it either tonight or in our next council meeting so that we can provide you with whatever guidance, direction, funding that you need to address the current situations without having to wait for scheduling. So I'll just say that to CAC. If there's other council members that agree or disagree with that, perhaps we can at least tee up a discussion for the next council meeting, which is, I think, 2 weeks from tonight. Thanks, Chris.
Yep.
Thank you, Bob. Next, we've got Aaron, Adam, Mark, and Mirabai. Aaron?
Thanks. I was actually going to bring up the same concern that Bob raised. It's just that the really troubling additional reports of violent and threatening behavior, which are very concerning. You know, the things like the person threatening people with a machete, or that kind of terrifying story of the teacher who had to evacuate a bus with all of her children because of someone saying that they had a gun and was going to blow all their heads off. So it seems like those are, really significant criminal behaviors that need some real attention. So I'd welcome the chance to hear more about what steps we're taking about those kind of violent behaviors.
Thank you, Aaron. Next, we've got Adam.
I'm going to third that. One point of distinction, though, I think it's important we not conflate our meeting about people experiencing homelessness with an update about crime specifically, just because I think they're separate issues and we shouldn't conflate the two. So I'm interested in an update on people committing crimes and a update on what we're going to do to address people experiencing homelessness. Chris, one point I would add is it's my understanding, at least anecdotally, that positive activity often offsets negative criminal activity. So the faster we can get to sort of normalcy where people are vaccinated and can go out again and go downtown, we should see a corresponding decrease in this type of activity. And I'd love an update as part of the update from you and Chief Harold, whether or not you think that's the case.
Thank you, Adam. Mark?
Yeah, I want to also jump in and request that earlier update from the chief or from Chris. A couple of days ago, I was in correspondence with some of the restaurant owners on the mall. They are apoplectic. And more importantly, they are rightfully apoplectic as to the conditions in which they're trying to operate their businesses. They've gone to great lengths to survive COVID, and now they're in danger of being put out of business because their staff isn't safe, their customers don't feel safe, and people are not going to want to frequent restaurants in an unsafe area. So this is something I think we're getting into a different territory here in terms of the conditions under which our businesses are operating, as well as our families. Again, I would agree with Adam. This is not a homelessness conversation. This is a public safety conversation. I think we need to have it and be able to address some of these very legitimate issues and concerns. Thank you.
Thank you, Mark. Mirabai?
Yeah, I just want to throw my hat in the ring as well on this topic. And I think most of what I wanted to say has basically been said by my colleagues, but just to the community that we're hearing you, I'm very sorry that you've been having to deal with this situation on top of the COVID issue. And I think you clearly have everyone's attention. So I think as soon as we can get this on our meetings, the better.
Very good. I see no more hands up. I will concur. I will also say that it's clear we have a majority of council that's interested in this, Chris. So we will bring this up at CAC on Monday, and then we'll talk about how to schedule it in for an update on the 16th. And then just a reminder, the general discussion about cleanup, enforcement, ambassadors, and encampments will be April 27th. And then we'll have an additional discussion on May 4th, which is concerned with potential policy and ordinance changes. So with that, I will bring open comment completely to a close. And I'll turn to council and suggest this is a convenient time perhaps to take a 5-minute break. Tell me if you don't want to. All right, I see thumbs up. So it is currently 8:15. We'll reconvene at 8:20. Thank you all. Okay, council members, it's 8:21. If you're around, if you could turn on your camera. Very good. We are waiting on Mirabai. There she is. Very good. With that, I will turn the meeting over to Alicia.
All right, sir. Next on our agenda is the consent agenda items A through H.
Very good. Do any council members have comments or questions? Aaron.
So part of those is appointing members to committees, and that some of that has fluctuated. So could we just call out, please, who we're appointing to what committees as part of this?
Thank you, Aaron. I believe who we at least tentatively have is for the city attorney recruitment subcommittee. I believe Bob and Rachel have been nominated for that. And then for the CU South process subcommittee, I believe Mark and Aaron have been nominated for that. Rachel, I see your hand.
Yes, I had a couple of comments on consent. And so one was like, do we need to amend the consent item like 3G? Do we need to change that to say Friend and Yates as an example? And then 3H also maybe needs some verbiage change before we vote. Maybe.
So I'm sorry. That would be the motion. So whoever makes the motion to just include adding those names to those blanks.
Okay. And then also, let's see, under 3E, just a question. It talks about sort of needing some on the mobility options and having electric scooters on paths and things, and it mentions in there needing to have signage and sort of public awareness about the speed limits and things like that. So I just wanted to flag, like, is it possible that as we're looking at these ambassadors that might be downtown, could we look at rolling those two job duties together at all? Like, could the ambassadors who are going to be going up and down the creek also be made aware of speed limit changes and things? So just wanted that to be flagged for maybe discussing at second reading.
Super. I think that's noted.
Okay, and then just one more on the CU South subcommittee. I just wanted to impress that when I first got on council, I actually had asked that we maybe think about disbanding this subcommittee because it had been so easy to veer into substance and not stick to process on it. So whoever the new subcommittee members are, I just wanted to flag that it is a space where people have a lot to say on it, and it's so easy to go into substance, and just wanted to make a request that the new subcommittee really take note of the limited nature. I think that the in the verbiage, it says, it reminds us the purpose of the CU South process subcommittee is to monitor and provide input to staff on public engagement and discussion of policy issues, annexation terms, or flood mitigation design will not be part of the purpose. So just wanted to flag it as we're kind of changing membership, because it's easy to get lost because, again, there's just such deep beliefs on this issue, and a lot of people want to talk about the substance a lot. So that's all. Thanks.
Thank you, Rachel. I see, hang on, let me pull up my notes here. Aaron and the Mirabai. Aaron?
Thanks for that, Rachel. And I just wanted to say, thanks for enumerating the names, listing those names, Sam, of who we're appointing. And because there was some concern from some community members at our last meeting about what we were appointing people for with regards to CU South. And so just to be clear that the action that we're taking this evening, if the consent agenda passes, is that Mark and myself would be appointed to the CU South Process Subcommittee, and that's it. And then Rachel, thanks for those words. I understand that you and Sam have both done an exemplary job at keeping the committee focused on process and not on substance. And I pledge to do my best to continue that tradition the two of you have set up.
Thank you, Aaron. Mirabai.
I just had a question, I guess, probably for Tom, around, and just, I've had council or community members reach out about this, saying that it's bypassing charter requirements. So can you explain the problems with, I mean, I've just heard from a number of community members that they're very unhappy about this process. Many of the people around the CU South area and how we're appointing this. I'm just, before voting on it, I'm just concerned that I want to make sure we're not doing something illegal here by appointing the people.
You're not, and I don't believe the concerns were over the process committee. The process subcommittee follows all the meeting rules because it's a designated committee of council.
Sorry, then I'm sorry, I apologize. It's around the one that Sam and Rachel are going to be on, but I guess that's not on consent agenda then.
Because it's not a committee. They were invited to advise the city manager on negotiations. And
okay, so seeing as it's not on consent agenda, then it's not a discussion we can have here then, I guess.
Well, yeah.
Okay. All right. I'll bring it up then at some other point then, apparently. Thanks. Sorry about that, Tom.
Okay, very good. So I think any other questions or comments about the consent agenda? If not, I would invite a motion, and in the motion, please name the people, the council members for GNH. Bob.
Yeah, I'll make a motion. I move the entire consent agenda, and with respect to the CU South Process Committee, the appointment should be for Mark and Aaron, and with respect to the City Attorney Search Committee, it should be Rachel and myself.
Second. Okay, we have a motion and a second, and I believe this is a show of hands. Yeah. So I will ask it in. So everyone who approves the consent agenda, please show your hand. Okay, any opposed? No. Mirabai, would you like to vote? Is that a yes? Okay, so unanimously the consent agenda passes. And Alicia, we're on to the next item.
All right, sir. Thank you, everyone. We have item number 4A, which is a call-up consideration for a concept plan review and comment for a redevelopment of the property located at 77028, the existing Boulder Best Western Motel, into a mixed-use project with 90 to 95 student apartments units, along with ground-level restaurant or coffee shop use, common areas, and below-grade parking, along with landscape and shared open space improvements to the site and the existing office building located on the east end of the property at 777 29th Street. The existing 5-story office building will remain. It is reviewed under case LUR 2020-00060.
Thank you, Alicia. Turning to council, do any council members have interest in calling this up or questions for staff? Great. Seeing none, I think we will not call this up, and we're ready to move on.
All right, sir. Next we have items. Sorry.
Oh, sorry to interrupt. I just before we move on, just to be clear, because it's not 100% clear, that this is not the Marpa House redevelopment that so many open comment speakers were speaking to. We're considering whether to call that up in 2 weeks.
That's correct, Aaron. Council will have the opportunity to review the non-conforming use review proposal for the Marpa House on the 16th of March.
Okay, thank you.
Very good. Thanks for that, Aaron. All right, Alicia, back to you.
Next, we have our public hearings. The first on tonight's agenda is item A, the second reading and consideration of a motion to adopt Ordinance 8444, designating the property at 9779 Street as an individual landmark per section 9-11-5 of the Boulder Revised Code 1981.
Great. And for this item, Marcy Gerwing from our Planning and Development Services Department is here to present these designations.
All right. Good evening, Council. We do in fact have 3 designations in front of you tonight. And so I will go through the quasi-judicial procedures for this first one, but to cover all 3. Oh, I will share my screen. Could I have permission to share my screen, please?
Taylor should be able to put your presentation up on the screen. Taylor, if you can pull that up.
All right. Okay, if you could go to the next slide, please. Okay, so the procedure for a quasi-judicial hearing starts with a staff presentation, followed by the applicant's presentation. The public hearing is then open for public comment. And after everyone from the public has spoken, the owner will have a chance to respond to anything that was said. The public hearing is then closed and City Council discusses, and a motion requires an affirmative vote of at least 5 City Council members to pass. Next slide. The criteria for your review is found in Chapter 911.5 of the Boulder Revised Code, which is to determine whether the designation meets the purposes and standards of the ordinance in balance with the goals and policies of the Boulder Valley Comp Plan. That is, whether the designation would protect, enhance a building, site, or areas important to our history, or provide significant examples of architectural styles of the past. Next slide. The options in front of you tonight are to approve the designation, modify and approve, or deny the designation. And next. And then this case started back in August when the property owner submitted the application. In December, the Landmarks Board unanimously voted to recommend designation. First reading was earlier in February, and tonight is the public hearing. Next slide. The property is located on the northwest corner of 9th and Euclid in the identified potential University Hill Historic District. Next. This Gothic revival building evokes old world charm, but is deceptively innovative. The building is positioned at a 45-degree angle on the lot with a split level plan called Boulder's first split level house, built 1899 to 1906, with large windows so that every room in the house receives sunlight at different times during the day. It was designed and built by Benjamin Franklin Gregg, who also designed the Octagon House near the Academy and other houses in University Hill. He owned the Boulder Cement Company, and the caps on the castellated parapet are a very early use of the material. And he built this house with his son, who hand chiseled the bricks and dipped them in a maroon stain. There were quite a few interesting characters that lived here over the last century. There's an early city council member, an author, a groundskeeper at Chautauqua, and Leslie Kelso, who's been described as a pioneer Boulder mortician. Next slide. And your criteria for review in Chapter 911 looks at the property's historic, architectural, and environmental significance. Next. So this house is what early preservationists had in mind when writing the landmark designation criteria, and it checks nearly every box. It's historically significant for its date of construction and its association with Leslie Kelso, the mortician, and local author and CU professor Jane Fitz Randolph. The house has been featured in Jane Barker's book, 76 Historic Homes of Boulder County, and was recognized by the Landmarks Board as a structure of merit in 1987. And the building is potentially eligible for listing in the National Register of Historic Places. Next slide. So in terms of its architectural significance, it is an excellent example of the Gothic revival style and for its association with Benjamin Franklin Gregg. The house represents a skillful integration of design, materials, and color, which is of excellent visual quality and demonstrates superior craftsmanship. The house is unique in Boulder and probably beyond Boulder as this castellated variant of the Gothic revival and for its innovative and very early use of concrete. And then the brick was sourced from the Austin Brick Company in Boulder, and the sills are made of local stone. Next slide. And then in terms of its environmental significance, the lot is prominently located on the corner of 9th and Euclid and oriented to maximize the natural light and is a visual landmark within the neighborhood. And also located within an identified potential historic district. Next slide. So the proposed name for the house is the Castle House, which is what it has been known for at least 40 years. And the boundary is very straightforward as it follows the property lines. And then the last one, with that, staff recommends that the City Council designate the property at 977 9th Street as the Castle House as an individual landmark under the City of Boulder's Historic Preservation Ordinance. And Lori Schuler, the owner who has owned the house for the longest time in this house's 120-year history, is here to speak to the designation tonight.
And Marcy, could I ask a quick question? Have we stopped the requirement for being sworn in before landmarks quasi-judicial hearings?
It's my understanding that council does not swear in speakers for landmarks.
That's right. Council made that change a while ago.
Okay, thank you.
Marcy, I'm not seeing a Lori Schuler in the meeting. I do have a Lori with a different last name. Do I need to be allowing that person to speak?
Yes, she may be under Lori Lucas.
She is. Okay, I'll go ahead and bring her into the meeting. Thank you.
Hello.
Hello.
Hi. Is it my turn?
It is.
Okay. My name is Lori Lucas Schuyler. I live in the Castle House. Thank you, Marcy. I think Marcy pretty much said it all. It is a unique house. And because I lived in Europe before I lived in Boulder, I really appreciate the house, the wood, the 5-panel doors. The house and the garden are really quite spectacular. After sitting in on the last hour of the meeting and hearing talk of COVID and crime, I really feel that talking about my houses seems rather trivial at this point. So I'll keep it short. Does anybody have any questions or comments about the house? Most people know it. If you've ever driven up or down 9th Street, you've seen the Castle House. And I'm the crazy lady who dresses the gargoyles. So today, the Valentine hearts got taken down and the St. Patrick's Day hats got put up.
I see a couple. I see Mary and then Bob. Mary?
Lori, thank you very much for being here tonight and for landmarking this house. It is indeed a Boulder landmark. And I look forward to being able to see the inside of the house in one of Historic Boulder's holiday home tours, which hopefully we will get to have sometime soon again. So thank you very much.
I would like to respond to that if I may. My email is Lori, Lori, .Lucas, Lucas, @colorado.edu. And if you would like to contact me, I would be happy to arrange a time for you to come and see my beautiful house.
Super, thanks. And just a reminder to council, it's a time for direct questions or responses to the owner. Bob, and then Mirabai. Bob?
Well, Lori, I want to join Mary in thanking you for offering to landmark this property. I go by it all the time, and I've always wondered about the history. So it's great to hear Marcy share that with us. I just have a question for you, Lori. How much of the I know the house is about 130 years old. How much of the interior of the house are there elements in the inside that are original to the house, or at least very, very old?
Okay, great question. The house was completed, I believe, in 1905, 1906. So it's about 115 years old. It has all of the original wavy windows. It has the original old yellow pine floors. And much of, you can maybe see behind me some of the wood, the oak wood. So the people who lived here before me, Pam and Bill Schlenzig, I believe they lived here for about 9 years. And I think they spent most of those 9 years, I think Bill's passed away now, but I think they spent it kind of refurbishing and revitalizing the house, but not really changing it. And so there's a wonderful balance in the house of the old, the antique, the history, and yet modernized to make it convenient and livable. And then I have in it a combination of furniture that I found on the street, and that comes from Design Within Reach. So there's a funny combination again of the old and the new, of the antique and the modern. And I would say that pretty much describes me.
Well, thank you very much, Lori, for preserving both the inside and the outside of this beautiful home. We really appreciate it.
Thank you.
Thank you all. And seeing no more questions, I think we're ready for the public hearing. And we have, I believe, one person signed up.
That's correct. You have Lynn Siegel signed up this evening. I can go ahead and unmute her.
Very good.
Support. I best like the fact that this house is angled 45 degrees. That's pretty cool. Thanks.
Thank you, Lynn. Seeing no other people signed up for public hearing, I will close the public hearing, bring it back to council for discussion or a motion. Aaron.
I did have one follow-up question. Did I hear that an early city council member once lived in this house?
Yes, that's correct.
Well, I'm afraid, I feel like we should probably deny it on that basis alone then. Just kidding, just kidding. No, this is so exciting. Lori, thank you so much for bringing this to us. It's an iconic building. I enjoy it every time I walk, bike, or drive past it. So I appreciate this very much. I'm happy to put a motion on the table if that would be appropriate.
I think it would be fine, and we can have people speak to it.
Great. So I move that we adopt Ordinance 8444, designating the property at 977 9th Street to be known as the Castle House as an individual park.
Whoops, sorry.
It's all good.
Second.
All right. Aaron, would you like to speak to your motion?
Oh, I already did. This is just, it's very exciting. Thanks again, Lori.
Very good. Then I'll go to Mark and then Mirabai. Mark?
Yeah, for me, this checks all the boxes. I think it's a unique structure. It's got historical qualities to it. If there's any structure in town that ought to be landmarked, I would say this is certainly it. So I'm very supportive of that motion, and I hope we will decide to go forward.
Thank you, Mark. Mirabai.
Laurie, I didn't have a question for you, but I just wanted to say, being a Boulder native, this is actually my favorite house in Boulder. I've driven past it, I don't even know how many times, and every time I've always wondered, more just the stories, you know, imagining what that house has seen. I think I read at one point that it was actually haunted, and the university had put out a book, or somebody had put out a book about the haunted houses in the area, and that was one of them. So anyways, I'm just extremely excited. I'm actually shocked to find out it wasn't already landmarked. So I'm very excited, and I hope you enjoy living there, because it's what a house.
Very good. Thank you, Mirabai. Seeing no other hands, we have a motion and a second. I will go ahead and call the vote. All those in favor of landmarking the house and supporting the motion, raise your hand. Very
We need
good.
to do a roll call for this.
Oh, is this roll call? Thank you.
Yes,
Good
sir.
reminder.
For the next 3 items.
Okay.
All right, great. Thank you. We want to start with Councilmember Yates.
Aye.
Young.
Yes.
Brockett.
Aye.
Friend.
Yes.
Joseph.
Yeah.
Nagel.
Aye.
Swetlick.
Yes.
Wallach.
Aye.
And Weaver.
Aye.
Ordinance 8444, sir, is hereby unanimously adopted.
Very good. Thank you.
Moving right along, we have item 5B, which is also a second reading and consideration of a motion to adopt ordinance 8445, designating 2 buildings and a portion of the property at 90 Arapahoe Avenue as an individual landmark per section 9-11-5 of the Boulder Revised Code 1981.
Excellent. And one more note on the Castle House. I made very few site visits in the last year, but going to meet Lori and photograph that house on a beautiful September day was hands down one of my highlights of the year. So really incredible. And this next one also has a good partnership link to it. And so Taylor, if you could go to the next slide. The criteria for your review is the same in chapter 911.5. Next slide. And your options are also the same to approve, modify, or disapprove the ordinance. Next one. This application has a longer history, having been submitted in 2017 as part of the annexation agreement along with the property at 96 Arapahoe. The application was put on hold in agreement by the property owner and the city until the development was approved. And in 2018, the Landmarks Board approved the rehabilitation and construction of additions to the motel, to the 2 buildings that are in front of you tonight. In December, the Landmarks Board unanimously voted to recommend designation of the property, and first reading was earlier in February. So the property at 90 Arapahoe is located at the west end of Arapahoe near the mouth of Boulder Canyon. As I mentioned, the property was annexed together with 96 Arapahoe, which will be coming in front of you as also an individual landmark. And this landmark designation was part of that proposal. Next slide. There we go. This property with its 1940s motel office and cabins represents a later chapter of Boulder's history than the Castle House and is part of the city's growth related to automobile tourism. As cars became affordable for more people, road trips became a popular way to vacation. Eben G. Fine Park, located next to this site, opened as a municipal auto camp with cooking facilities and water in the 1920s. The Silver Saddle Motel was built in 1948 and operated until 2015. The simple cabins are designed in a rustic style, providing the mountain charm for visitors heading west into the Rockies. This slide is just showing the two different buildings on the property. The 4 motel cabins are there on the upper 2 slides, and then the motel office building was repurposed as a house, most likely built in the 1920s. It was moved on the site and used as the office building, and Blanche Taylor operated a hair salon out of the building for many years. Next slide. So there were a number of buildings on this property, a number of which were approved for demolition, and these 2 buildings, the cabins and the office building, were identified as potentially eligible and incorporated into the redevelopment plans. So this rendering shows the approved plans for very sensitive additions to both the motel cabins and the motel office buildings. And it took a pretty creative design approach to adapt these buildings, and it's shaping up to be a pretty neat adaptive reuse projects, and some of the units will be permanently affordable. So the criteria for your review looks again at the historic, architectural, and environmental significance. And so for its historic significance, it's significant for its date of construction around 1920 and then remodeled in 1948, which is when the cabins were built. It's significant for its association with Thomas and Blanche Taylor, who opened the Silver Saddle Motel, and the motel was in continuous operation until 2015. And then for its distinction in the development of the community as it's related to automobile tourism. And this was one of many kind of cabins or motel sites that were here to bring automobile tourism to Boulder. So for its architectural significance, it's a rustic motor lodge, and that's a pretty rare building type in Colorado. I used to be on the state Historic Preservation Review Board, and the state historian actually brought this building up as one of the few remaining motels of this era with these integrated carports still existing. And then finally, next slide, would be its environmental significance, which retains its historic character, and its setting at the edge of town is complementary to its use as a motel and part of its history associated with the automobile era in Boulder. And then Taylor, if you could skip one more slide. There we go. So the landmark boundary is a little unique in that it is around a 2-foot buffer around the footprint of the building on the west and north side, and then follows easements on the east and the south side. So while best practices is usually to follow the property lines, this boundary was is a balance between the different competing needs, and staff still feels that it will protect the buildings adequately and retain the site's historic character. And then the proposed name is the Silver Saddle Motel. And so with that, staff recommends that the City Council designate a portion of the property along with the 2 buildings as a local historic landmark to be known as the Silver Saddle Motel. And I'm happy to answer any questions you might have.
Adam.
Thanks, Marcy. Is the motel sign going to be required to stay?
There's actually 3 motel signs on the property, and so the 2 older neon signs will stay, but the bigger all red, all caps motel one is proposed to be removed.
That's unfortunate. I like that one, but I like neon a lot too. So,
Mark.
Are you aware of any other properties of a similar nature that have been landmarked? Automobile tourism oriented motels?
Oh, let's see. Not off the top of my head. I know statewide there are some, and there's also a historic context report written specifically for Boulder County about automobile tourism sites. And a lot of those early motels have been demolished. but off the top of my head, I can't think of another one in Boulder that has similar significance.
And my second question is, as the boundary for the landmarking is not the property line, but just a small buffer around the property, it's the subject property. How big a property remains outside of that?
It's rather large. And Taylor, if you could go all the way back to slide 20.
And as an associated question, are there current plans for the balance of the site?
Right, and the applicant or the owner's representative who's here, Tim Laughlin, might be better prepared to answer the questions about the rest of the development. What's up here on the screen shows the footprints of the buildings. Some of these have already been demolished, but where the black marker is that's the motel cabins, and then the motel offices to the west. And then the yellow shaded area is the rest of the property, which has been approved for redevelopment.
Okay, thank you very much. So I guess if there are no more questions, we're ready for the applicant presentation.
Can everybody hear me now?
Yep.
Okay. The downside of having two mute buttons. Good evening, council members. I'm Tim Laughlin from Surround Architecture, and just wanted to say a few words tonight about the Silver Saddle Motel. So this project started back in 2015 with an application for annexation and concept review. And in 2017, both 90 and 96 Arapahoe, property adjacent to the east, were successfully annexed into the city. Both properties played important roles in Boulder's history, and this fact was recognized during the annexation process. And you just heard from Marcy, that history. So, if we fast forward now past our site review, our landmarks, alteration certificates, our right-of-way, vacation, tech docs, final plat, we find ourselves here today completing another important step with the designation of two of the original Silver Saddle Motel buildings as historic landmarks. These two buildings form the gateway into what is to become the Saddle Creek neighborhood. So the rest of the property, there are 46 units in total. These two buildings will have 6 of those 46 units. And out of all of those 46 units, 19 of them are affordable units. That site review has been approved. Tech docs have been run through, and the final plat and subdivision agreement are being circulated for signatures within the city right now. So a few years ago, this landmark designation was, really a milestone somewhere way out on the horizon. And, we're obviously very excited to have finally arrived here, but we wouldn't have been able to get here without help. There are many individuals to whom we are thankful, and without help and input and patience from staff, from board members, and from many others during this journey, we would still be looking at that milestone on the horizon. So we do have a big thank you to all those individuals. We're very grateful for your help and your input along the way. The city is gaining an important historic resource with this designation, and all the work and effort that goes into that is worth it. To preserve these buildings for the next few generations. And as we just heard from Marcy, there's not very many examples of these buildings out there that have had a designation like this. Thank you.
Great. Thank you very much, Tim. Do we have any questions for the applicant? Adam.
Are any of those units, permanently affordable units, purchasable, or are they all rental?
They are all purchasable. None of them are rental. So the entire development, they're all for sale, permanently affordable units.
Wow, that's super unique. Thanks for that, Tim.
Yeah. Mary.
thank you, Tim, for your patience in going through this long process. My question is similar to Adam, except I want to ask what the AMI percentage of the for sale units will be.
So this project, I don't know if it's the first, but it's relatively unique. We have different levels established, and that was part of the annexation agreement. So there was the first, kind of group of units available are for low and moderate. So there's 5 units that will be low moderate income. The next level up, 5 units for 80% AMI. And then the next level up, 5 units for 100% AMI, and then 4 units for 120% AMI.
Thank you. That would cover some in the missing middle. So thank you for that.
Very good. Thank you, Mary. Any other questions for the applicant? Great. Seeing none, I think we're ready for the public hearing, and I believe we have one person signed up for the public hearing. That's Lynn Siegel.
Support. Mostly I like to get on public hearings because I prefer this portal, but I have seen this and the Castle House at Landmarks already and had a lot of comments that I could have said at the other thing, but I thought you just want to move ahead. So yeah, and it's interesting that Mark Wallach brought up that there was a second thing, because I remember something close to this one. Maybe it's on Phil Denev's project a little bit east of there and some of those buildings, but I remember a second thing too. And I don't know where that came up with Mark, but that's interesting. And what fascinates me is those imagery that you have, Marcy, from early 1900s. Of all the foliage, it's so desecrated back then, and now there's so much growth. It's just like, I'm from Seattle, so I get all the growth stuff, and it's totally because we've watered this place out so much. It's amazing to look at. But yeah, support, great. Thanks.
Thank you, Lynn. And I think technically we turn back to the applicant to see if you have any comments on the public hearing.
No comments.
Super. Adam?
Yeah, I'd like to make a motion.
I think we're ready for that.
Motion to adopt ordinance 8445 designating 2 buildings and a portion of the property at 90 Arapahoe Avenue to be known as the Silver Saddle Motel as an individual landmark under the City of Boulder Historic Preservation Ordinance.
Second.
Okay, we have a motion and a second. Adam, would you like to speak to your motion?
Yeah, I've gone by this property many times and I've always wondered the history of it. And it's super cool that it coincided with my time on council that we get to landmark it. So, and a major added benefit is that permanently affordable for sale housing, which is so missing in our town. So I really appreciate that as part of this really cool project. Super happy to be able to put that motion forward.
Awesome. And then I didn't catch who was the second, but would the second like to speak to this?
It was Bob, and I couldn't say it better than Adam just did.
All right, very good. I see no more. Oh, there's Rachel. Rachel.
Yeah, I just wanted to say thanks to Marcy and staff for following up on all the questions that I had at first reading and getting answers and information into the packet. So I really appreciated the additional information and helped me understand why we're landmarking. So thanks much.
Thank you, Rachel. Seeing no more questions or comments, Alicia, I think we might be ready for a vote.
All right, sir. Thank you. Councilmember Young.
Caught me off guard. Yes.
That's what I'm good at. Brockett.
Aye.
Friend.
Yes.
Joseph,
Yes.
Nagel,
Aye.
Swetlick,
Yes.
Wallach,
Aye.
Weaver,
Aye.
and Yates.
Yes.
Sir, ordinance 8445 has passed is adopted unanimously.
Very good. Thank you, Alicia.
Next on our agenda is 5C, which is a second reading and a motion to adopt ordinance 8446, designating the property at 2230 20th Street as an individual landmark per section 9-11-5 of the Boulder Revised Code 1981.
All right, so last one this evening. Taylor, if you could go to the next slide. There we go. The criteria is the same and your options are the same. So if you could go forward to the process slide. So this one started back in July when the landmark designation application was submitted. Similar to the Silver Saddle Motel, this also came in through the discretionary review process because this property is a planned unit development and the owners were seeking an amendment to that agreement. And so because the house is potentially eligible, submitting a landmark designation application was part of the approval. So the Landmarks Board saw this last month in February, and then it went to first reading February 16th. Next slide. And this property is located in the Whittier neighborhood on the east side of 20th Street, just north of Whittier Elementary. Next. In this house, I think these three properties in front of you tonight show a real range of the landmarks that are in Boulder's program and also of the history of the different styles and different time periods that make Boulder unique. And so this is a relatively small house, but rich in detail. It's an excellent example of a craftsman bungalow house, and it's very visually prominent because there's an alley that runs along that south side. So in the neighborhood, you really get a full sense of this house. So the house contributes to the eclectic character of the Whittier neighborhood, and it was built in 1924. And over its last 100 years or so, it was owned by two main families, the Barnes and the Gallards. And next slide. There we go. So in terms of its historic significance, it's significant for its 1924 date of construction and its association with both of those families. Eugene Barnes was born in Iowa and moved to Boulder in 1903. And he was an employee for the Mountain States Telephone Company for 40 years until his retirement in 1942. And he was involved in many different fraternal organizations. He and his wife Blanche married in 1904 in Colorado Springs. And she was also very active in the community. And their 50th wedding anniversary was celebrated in the newspaper, which I don't think we see quite as much these days, but it goes into great detail about the color of the flowers and the number of guests. The property's longest residents were William and Eva Gillard, who purchased the property in 1942 and lived there for 42 years. And William worked for Boulder County's Road Maintenance Department. Next slide. So in terms of its architectural significance, as I mentioned, it's an excellent example of the craftsman bungalow style, which you can see, it was popular in the 19-teens and 1920s and is relatively simple in design, but it's very well preserved with its tapered columns, its traditional windows, and its double gable front. And then lastly is its environmental significance. As I mentioned, visually prominent because of the alleyway and very traditional in terms of a residential lot in this part of town. And it is located in an identified potential historic district in Whittier. And so next slide. The landmark boundary follows the property lines, and the name is proposed to be the Barnes Gillard House. And so with that, staff and the Landmarks Board recommend that City Council designate the property at 2230 20th Street to be known as the Barnes Gillard House as an individual landmark under the Historic Preservation Ordinance. I'm happy to answer any questions about this one.
Thank you, Marcy. Any council questions for Marcy? I see none, so I think we can move on to the applicant.
Marcy, can you give me the names of the applicant or applicants so I can move them into a panelist position?
Yes, it's Laurel and Mark.
Okay, I see them here. Let me go ahead and do that. Thank you.
Mm-hmm.
Is the video working? Hi. Hi, everyone.
Hello.
Okay, good. Hey, thanks, Marcy. Great presentation. We don't have really formal comments. We're happy to answer questions. And even though it's no castle house, we are excited to help contribute with a more modest dwelling. And we are excited to also even restore that back to, its beautiful craftsman charm on the inside and outside as well. So, but I'm happy to take questions from you guys if you have any for us.
I have a quick question for you. I was curious what motivated you to submit this for landmarking?
Well, so it's really close to our house, and we knew the owners, and we had told the owners a long time ago. It had been owned for about 10 years, and there was renters there. And we wanted to find a house for Mark's mom to live in town. So that was our original motivation. We didn't know it was a PUD at the time, so that all came as a bit of a surprise, but we didn't want to do a whole lot to it anyway. So it kind of was a mutually beneficial situation.
Super. Well, thanks very much.
Yeah, absolutely.
Any other questions for the applicant from council? Great. Seeing none, I think we'll move on to the public hearing. And I believe we have one person signed up for that, Lynn Siegel.
Yay. That's it.
Super. Thank you, Lynn. Well, I think we bring it back to council for discussion or a motion.
If somebody could put up the motion language, I'd be happy to make a motion.
Rachel's got her hand up. Rachel?
Oh, okay, great.
To say the same thing, I'm happy to make the motion, but I needed the language.
Okay.
And I will, we can't all live in castles. I appreciated that sentiment. Okay, so I will make or hereby move to adopt ordinance 8446, designating the property at 2330 20th Street to be known as the Barnes Gillard House as an individual landmark under the City of Boulder Historic Preservation Ordinance.
Second.
Very good. We have a motion and a second. Rachel, would you like to speak to your motion?
I just support staff's presentation and the property owner's support of landmarking, and am happy to move us forward in that direction.
Super. Thank you. Mirabai, anything you want to say?
I'm just excited to have another beautiful home landmarked and preserved for history.
Super. Thanks. And I'll just comment that this is a few blocks from my house, and it's great to see all these craftsman homes being landmarked. There's a few, I'm on 23rd Street, and there's a few just down the street from me. And so it's great to see. So thanks very much for bringing it forward. It's great to preserve these.
Thank you.
And Alicia, with that, I think we're ready for a vote.
All right, sir. We'll start with Councilmember Brockett.
Aye.
Friend.
Yes.
Joseph.
Yes.
Nagel.
Aye.
Swetlick.
Yes.
Wallach,
Aye.
Weaver,
Aye.
Gates,
Yes.
and Young.
Yes.
Sir, ordinance 8446 is hereby adopted unanimously.
Very good. Thank you guys for bringing it forward. Congratulations.
Thank you.
Thank you.
And Bob.
I just have a question for Marcy. Marcy, have we ever done 3 landmarkings in one night?
No, we have not. As I did put in the 90 Arapahoe memo that staff is catching up on a bit of a backlog of these, especially the ones that came through discretionary review. So you will see more of them this year, though probably not for a couple more months, but 3 is more than we've ever done in one night.
Well, congratulations. Thank you, Marcy.
Yeah.
Call it a historic hat trick.
Was it our first one with neon too? Because I think that's pretty important.
Okay, so the other automobile related one that I thought of after Mark's question is the Holiday Drive-In movie theater sign, which does have neon on it. So I think this is at least the second.
We're getting there then.
I have to say, that sign is 2 blocks from my house. And for several years, I had the honor of getting to turn it on a few times a year for special occasions. And there's nothing like seeing that sign lit up.
Okay, so I think that Alicia, we're ready to move to our next one.
All right, sir. Thank you.
Thank you, Marcy.
Next, we have item 6A, matters from the city manager, which is the community benefit and site review criteria check-in.
Great, thanks, Alicia. And for this item, we'll welcome Carl Geiler and Charles Farrow from Planning and Development Services.
Thanks very much, Chris. Carl Geiler is going to present staff's update this evening, as well as the questions for council.
Thank you, Charles. Good evening, council members. I'm Carl Geiler with Planning and Development Services. We're here for an update on the Community Benefit Phase 2 project. So the purpose of tonight is to update City Council on the progress of the project since the August 2020 study session. We want to present the staff proposals that we have on the project and also request some feedback on the proposals and get direction on the Appendix J map before conducting more outreach and drafting an ordinance. So we just basically want to check in and see that if we're still on the right track with the project. So just to recap on the study session from August 2020, most of the council was favorable towards the 3 additional community benefit options moving forward. There was one council member who questioned moving forward with the new options with the concern that it may dilute the focus on permanently affordable housing. The thought was that maybe the program should be more weighted towards affordable housing. Nevertheless, most of the council agreed with the approach. They found that the program should be predictable and flexible. It should be developed in a way that's feasible and incentivizes developers to take advantage of the program. In terms of process, council felt that the on-site community benefit uses should be required in perpetuity like affordable housing requirements. There should be penalties applied when uses are not replaced after ceasing operation, but there should be some flexibility in the program to encourage some comparable replacements that are consistent with the goals of the program. And then with respect to the site review criteria, council at the time was favorable towards the approaches that staff was taking towards those changes. So tonight we're going to talk about an overview of the project really quick. I'm going to give a summary of the Kaiser Marston Associates analysis that we've recently received. I'm going to cover the Community Benefit Phase 2 staff proposal, the staff proposal on the Appendix J map changes, as well as some other intensity changes that we're proposing, giving an update on the site review criteria, and then we'll conclude with questions for City Council. So real briefly, we've given this presentation a number of times. I think you're all familiar with kind of the history of the project, but there were some concerns in 2015, particularly with the number of buildings that were going up around Boulder that were 4 and 5 stories. And there's been a long conversation about, the city should be getting something in return for granting that additional intensity and height to buildings. So the Appendix J map, which you see up on the screen, was adopted at that time. It basically limited where height modifications could be requested in the community. You can see it was limited to mostly adopted area plan areas where additional height and intensity was envisioned. And then in 2017, there were some new Boulder Valley Comprehensive Plan policies that were developed to basically provide guidance on community benefits. So there's the 1.11 enhanced community benefit, 2.35 building height. Those are the things, the policies that have been guiding us through this project. So one thing I wanted to point out as we move forward is that the Appendix J map is set to sunset on May 31st of this year. So we did want to check in with you before moving forward, but there's a lot of progress that we still have to work on. So overall, the program is meant to incentivize benefits to the community through development proposals that propose to add floor area above FAR limits in limited circumstances, or additional height above the height limit up to the maximum of 55 feet in the city. So phase 1 was adopted in October of 2019. That focus was on permanently affordable housing, but we also did add a alternative community benefit that allowed for essential community facilities to be proposed as well. So now that we've moved into phase 2, we're focusing on below market rate non-residential space. So as we've talked about before, this is a focus on small businesses, charitable businesses, arts and cultural spaces, and human and service spaces that are in great need in the city of Boulder. So you've seen this graphic before. Basically what you see in orange is the areas that we would consider bonus floor area. The area in blue would be by right. So basically anything that's over the FAR limit or in a 4th or a 5th story as part of a height modification would be subject to this program. No buildings would be any taller than the 55-foot height limit. These particular areas shown in the orange would have a higher requirement for, as part of phase 1 for permanently affordable housing, a higher percentage. Or if it's a non-residential project, they would pay a higher commercial linkage fee. So you can also see the Appendix J map. When this was adopted in 2019, Council did add some to the map. So the Alpine Balsam area was added, as well as the RH3 zoning districts. So this slide shows all the outreach that we've undertaken since the beginning of the project. You can see there's a number of different ways that we've gotten the word out and gotten feedback on this. We talked about the Codapalooza open houses that we did in 2018, 2019. We had Be Heard Boulder questionnaires. We had a number of different focus groups. And some of you are familiar with the ULI webinar that we did on community benefit in October of last year. But in moving forward, obviously, because of the pandemic, we're still doing our outreach online. We intend to get feedback from council tonight and then reconvene our site review focus group and neighborhood representative focus group. We want to do some targeted outreach to stakeholders in the community. We're thinking about doing a more targeted Be Heard Boulder question that would focus predominantly on the Appendix J eligibility map. And then we're also talking about doing office hours where we would be available to answer questions from the public on the ordinances that are in development. So like I said, we've recently received the economic feasibility summary from Kaiser Marston Associates. This has informed the staff proposal that I'm presenting tonight. This is located in attachment C, I believe, in the memo. This was developed to inform the phase 2 options, making sure that they're equivalent to or greater than the value that was approved as part of phase 1. We didn't want things to be diverted away from permanently affordable housing. We wanted to be as equivalent as possible. The other focus was really to make sure that, if we develop these regulations, that they should be viable, they should be feasible for developers and incent them to want to come in with projects so that we do get some community benefits. what you can see in the table here is that there's a percentage of bonus floor area that would be for the community benefit use, and that's linked to the percentage of what the market rate would be set at. So I'll talk a little bit more about that in the staff proposal.
And Carl, before we move forward, I just wanted to point out that both David Dozma and Kevin Feeney from Kaiser Marston, our real estate economics advisory firm, are on the call this evening in case there's more detailed questions about the analysis.
So KMA has also recommended an off-ramp option, which I'll talk about. Again, payments would have to be equivalent to or greater than what would be paid at the start of a project. They've also put some recommendations out there on penalties. So moving on to the staff proposal, looking at the particular uses, there would be a requirement for a restrictive covenant, much like what was done at 30 Pearl. Basically trying to define what these particular businesses are. So we've listed inside the memo small businesses that would be limited to 50 employees, or we're looking at a cap of 2.5 million for an individual business. We're looking at charitable businesses that would be subject to 501c3s in the IRS code. We're also looking at businesses that provide affordable or inclusive goods and services according to the citywide retail strategy. We've listed a variety of arts and cultural spaces like performance venues, studios, and we've also come up with a definition that we're still working on, but for human and social service uses. I know there's been some concerns on planning board and council about for-profit type uses like nursing homes. So we've written that in a way that it would be targeted towards those uses that would accept Medicare for like nursing homes. So inside the memo, you'll see the more detailed presentation of that. With respect to the floor area and rent rate requirements, it would be basically, again, in perpetuity. If an applicant elects to have the rent rate set at 75% of the market rate, there'd be a minimum requirement of 9% of the bonus floor area as a community benefit use. If they elect to do 50% of the market rate, there'd be a minimum requirement for 6% of the bonus floor area. So this would be something that would be put inside the restrictive covenant. And then we're also looking at staff level reviews for use changeouts and reporting. So every 3 years, there would be a reporting requirement. So make sure that the applicant is demonstrating that they're still charging the appropriate rents for the space and what the tenants are. We want to make some flexibility, so there'd be administrative reviews for change outs. We'd be looking at that for consistency with the program. If there are situations where they're having difficulty renting those spaces, we would have payment for prolonged vacancies, like a penalty fee. So what we're looking at is a 3-year grace period to allow them to get a different use in there. We could choose a different timeline for that. But after that period of time, there would be a monthly penalty that would apply to the project until they get a new tenant in there. So I wanted to also say that this is new territory. Obviously we're trying to base this on like what is done for affordable housing. In this case, it would be something that would be a program administered by Community Vitality. So I wanted to point out that the Community Vitality is also here. The team is here to answer questions as well if there are questions on this. So moving on to fee options, we wanted to get some feedback on this. One idea is to actually replace the commercial linkage fee requirement that we adopted in phase 1 and replace it with a requirement for on-site affordable commercial spaces. And in doing so, it allows the possibility of doing an in lieu fee that would be directed towards securing more affordable housing spaces or helping more of those spaces in the city through an in lieu fee fund. So we wanted to get some council feedback on that. We're also looking at the off-ramp option that the KMA report talks about. So basically, again, trying to offer some flexibility in the program. If there's a situation where someone can't market their space and they can't get somebody in there and it just doesn't seem to work out because of market conditions, we're talking about an off-ramp option where they basically would pay the the full in lieu fee based on the square footage at time of construction to leave the program. The reason it's recommended to be the full in lieu fee is that we don't want to create a program that just incentivizes people automatically doing in lieu fees, or provide, or as the KMA report talks about, having a long-term affordable commercial space that could be viable, but over time it's just easier for them to just do an in lieu fee that's been reduced to just leave the program. So that's why it's proposed to be the full in lieu fee to leave the program. So moving on to the Appendix J map, Attachment C has a pretty detailed analysis of all the different zones in the city to help City Council in their decision about what to do with the Appendix J map. As we say in the staff memo, the map has been useful at directing where height and intensity is in the city by having it in these limited areas. But the downside of that is that it has limited the viability of the community benefit program because of the limited areas. So part of the KMA report talks about how obviously opening up more zoning districts or potentially repealing the map and going back to the conditions prior to 2015 would obviously allow more projects to come in and more community benefit. But if council wasn't comfortable with doing that and wanted to take an incremental approach, that's why we provided that zone by zone analysis in the memo. So if it were not to be repealed, these are some of the recommendations of staff. So adding most of the BR1 zone, which is in the vicinity of 29th Street, basically the areas north of Arapahoe and east of 28th Street. Based on some concerns about taller buildings in Gun Barrel, we've revised that particular area in our proposal to just include the BR2 zoning district, which is the core of the Gun Barrel Community Center up there. Next place would be Diagonal Plaza in order to encourage and incentivize development of that area and more affordable housing. We're recommending the Ball Aerospace site that's located next to an area that's already mapped by the Boulder Community Health. Ball Aerospace has already gotten approval in the past for taller buildings, some of which they've not undertaken, but they do have some expansion plans. It is in an area that has buildings that are 55 feet, so we're recommending inclusion of that particular area. In addition to that, we've recommended a number of different zones like BMS, IMS, and the MU1 and MU2 zones up in North Boulder. These are zones where you could add the eligibility to these particular areas. What we're recommending is if there's concerns about compatibility, we could start with like potentially a 45-foot height limit, just to try to get some smaller buildings that are more consistent with the scale of buildings in that area for those particular zones. But part of this analysis has raised some other changes in the zoning code that we wanted to go over. So one we've mentioned to council before is we've heard from the development community that one of the biggest barriers to additional housing, particularly affordable housing, is in the BR1 zone. When you look at the Boulder Valley Comprehensive Plan, it talks about the BR1 area as a predominant focus area for more affordable housing. So one way to do that is to allow the current density limitation that we have in that zone, which is 1 unit per 1,600 square feet of lot area, by waiving that for any project that has permanently affordable housing. So if there's a building or project that's all affordable housing, you could put it in the code to waive it. And that's one thing we're recommending. We're also looking at that for the BC zones. It doesn't necessarily mean that we could allow the additional height in those areas, but it would incent permanently affordable housing in some of the neighborhood centers by allowing that to be added to the code. There's also some recommendations in the code and similar to what we did in phase 1, there are certain zones that are less than 1.0 FAR where it wouldn't be as feasible for them to take advantage of the program. So KMA has recommended that those particular zones be increased as well to 1.0, and that's the BMS, IMS, the MU1 and MU2. We also have some recommendations for the DT4 zone. There's already, not to increase the floor area, but just adding community benefits as an option for getting that additional floor area. Right now in the code, there's different types of uses that allow you to get to the 2.7 maximum. We're recommending that that could just be, you could add the community benefit option to downtown as well, so that we can get some of these community benefit uses in the downtown. Lastly, the DT5 zoning district, the most intense zone downtown, you can get up to a 2.7 right now. In this case, we're recommending, you could make it 3.0 downtown if there's community benefits associated with the project. I know that's a lot of information to swallow. So lastly, we're going to talk about the site review criteria. So again, the site review criteria changes are quite complex. We're drafting them at this time, but because of the complexity, it does require some more time. So we're not thinking that the site review criteria changes would be done in the short term. It'd probably be more towards the end of summer. Attachment D contains a description of how the criteria are being updated right now. We expect to do some more outreach to get some feedback on the changes. But one thing we wanted to get feedback on from council tonight is the view protection issue. This was one of the goals of the project, was to make view protection a little more predictable in the code. One analog that we've been looking at is Denver. They do have view planes from public spaces like we've been looking at. They basically have a view plane that starts from a public park towards the mountains that limits the height of buildings. We wanted to see if council wanted us to continue looking at that. Obviously in Denver, we're talking about much taller buildings in these areas. But I think if we do move forward with this particular task, we probably would ask for some assistance from a consultant to do the mapping and view plane analysis. So we wanted to get some feedback on that tonight. So I'm gonna just read through the questions and then we'll talk about next steps and I can come back to the questions. There we go. So the first question is, does City Council support the staff proposal as specified within the memorandum? That's related to the community benefit piece. And then more specifically on the non-residential projects, instead of applicants paying a higher commercial linkage fee for the bonus floor area in commercial buildings as established in phase 1, should a requirement for on-site affordable non-residential space be created with an option to make an in lieu payment that would be used to create additional affordable non-residential space and to cover the program? And then secondly, we're asking, should an in lieu fee be created as an off-ramp option for the non-residential projects that are unable to lease their below market rate commercial spaces? The third question is, does City Council generally agree with the staff recommendation for the changes in Appendix J? We're not asking for any decisions on this item tonight. If there's additional information that council would need to help with that decision, we're all ears. And then lastly, on view protection, should staff develop options for implementing a view protection ordinance in the city of Boulder? So I'm just going to go to next steps and we'll come back to the questions after we do clarifying questions. So as far as next steps, we expect to do additional community outreach like we talked about on the slide. We're going to continue development of the ordinance. If we can keep to the timeline before the Appendix J map expires, we're going to try to get to planning board if we can by April, and then before council in May to bring these changes related to the community benefit before council. If it looks like we need more time, we may have to extend the Appendix J map if needed. So that, oh, and then the ordinance for site review criteria, as I said before, would probably be coming late summer, early fall. So that concludes my presentation. Happy to answer any questions. And again, we have KMA here and Community Vitality to help with questions.
Super. So I'll just start with a quick comment. Thank you very much for the great memo and the great presentation. It's very clear. And I also want to say that I appreciate the timeline this is on, because it looks like we're going to move through community benefit as well as site plan review criteria this year. So I just want to say thank you to staff for all the hard work and for keeping us on schedule with this. With that, for questions, I've got Mirabai, Junie, and Mark. Mirabai?
Thanks for the presentation, and yeah, I appreciate all the work as well. I don't know if this is okay to ask right now, but I'm hoping we can just help out the Gun Barrel community here, because I've received a lot of emails about Appendix J, as it sounds like you guys have as well. So could maybe you go over, it sounds like you've changed it to the BR2 zone only. And so can you explain a little bit more in depth with what that means? Does that mean that only in that area they can, a developer can ask for a height increase if they provide the community benefit, or does that reach outside those zones? Just can you give a little bit more detail for the residents here?
Yeah, if council were to limit it to the BR2, it would be that the community benefit program would only apply to that particular zone in Gun Barrel, where they could ask for height modification and they would have to provide community benefit. What we've said in prior meetings, obviously, is the Gun Barrel Community Center Plan is actually pretty clear about taller buildings in Gun Barrel. So if anybody asks for a height modification, it has to go through a whole process with the county, and they have to sign off on it as well. So it's a higher tier of review than other parts of the city. I worked on the Gun Barrel Center project out there. They had a railing that was a little bit over the height limit, and it was a pretty involved review, just to put it in perspective.
Okay, great. Yeah, I think that's just good with this being, something that not everyone deals with on a day-to-day basis. I think it's helpful to help clear it up with them. Can you just, one other question regarding this, because again, a lot of the residents have said this, due to the unique nature of Gun Barrel, many of the people who live and use the facilities here and have their quality of life experienced here, unfortunately don't get a vote in the city of Boulder due to being in the county, which by no fault of their own, they're just not in our city. Is there a possibility, I understand you're saying that if a height increase was requested, it would then be required to be worked on with the county. Is there any other safety, they're just basically saying they don't have a voice here. So is there any workarounds as we do this that would allow the county to be more involved, to have more conversations with us, and work with us on this a little bit further?
I mean, I can certainly, work with our colleagues in the county to make them aware of this project. Again, there's a memorandum of understanding between the city and the county for that Gun Barrel area. I haven't looked at that MOU in a while, but I know that if they do ask for an additional floor above 3 stories, it does open up the review to their Board of Commissioners and their Planning Commission, and there has to be hearings and recommendations from the county side. So that they should, I would expect, have a voice through that process before it even comes to City Planning Board and City Council.
Okay, great. I just appreciate you clarifying again. It's just so the residents can hear this as well, coming from city staff, and hopefully have some of their fears assuaged. So thanks.
Thank you, Mirabai. Next, we have Junie, Mark, and Bob. Junie?
Thank you. I had a question. I believe it was when you were talking about on slide 11, when you were talking about small businesses, and you mentioned businesses that are, I guess, worth no more than 2.5 million. And I was wondering, where did this estimate came from?
That was something that was suggested by Community Vitality. I don't know what that metric was based on, but maybe I can defer to them on that one.
Sure, this is Jennifer Pensino, and that 2.5 million refers to the annual revenue of a company. So that's one of the measures that we use for size, and that's based on what we used, the county just used for small business grant programs. We've also used a similar measure when we look at our Boulder microloan program. So typically, a company that has less than 2.5 million in annual revenue or sales tends to be on the smaller end of the scale.
Thank you. Yeah, it's just when you hear 2.5 million, you don't think of small businesses, but thank you for clarifying. And I think I have another question. You mentioned when you were talking about the floor area and the rent rate, I was slightly confused. I didn't fully understand. The ratios when you were talking about them. So I was wondering if you could.
Yeah, so if an applicant were to elect to have a community benefit space restricted to only 75% of the rent rate, they would have to provide more floor area. So there would be 9% of the bonus floor area would have to be the minimum that they provide based on that. When you go to the 50%, it's a smaller percentage, so it goes to the 6% because the rent rate is even lower. So it's trying to obviously deriving from the KMA report what makes sense feasibly for this to happen.
Okay, thank you.
Could I tag on to Junie's first question, please? I just was wondering on that 2.5 million, does that account for number of employees as well? And does that look at expenses? How do you determine, is it just revenue?
Yeah, so we would be looking at businesses with up to 50 employees, and we would also be looking at or revenues of that amount. And so that does not include expenses. So that's before expenses, and that would be on the top end.
And I guess, so the 2.5 million was a cap on who could be eligible for the reduced rate commercial.
Correct.
And have we thought about at all about what happens if during their tenure in that affordable commercial, their revenues go up wildly?
Yeah.
Yeah.
Yeah, that's a really good question. That's something we're still exploring and thinking about. I mean, the idea is that we want to really set this up to help a company be successful. And so the question becomes, if you have somebody who is very successful and they've built a business that's very dependent on a particular location, we may not want to tell them they have to leave. So we're in the process of thinking through what some of those options might be. And it may be that those are written into the covenant so that we've got some flexibility based on a particular location and market conditions.
Thank you, Jennifer. I look forward to hearing what you come up with.
Thanks. I should also just quickly mention that as we're developing these programs, both on the citywide retail study, as well as on this program and other small business support programs, we'll be coming back to council later this year with updates.
Thanks much.
Very good. Thanks. Mark and then Bob. Mark?
Sorry? I have a couple of questions.
Oh, I'm sorry, Junie. I thought you were done. Go ahead, Junie.
Thank you. I just had a question about the in lieu, because I understand in lieu when it comes to affordable housing, when it comes to residential, and I didn't fully understand why would it be advantageous to have in lieu as opposed to on site.
Well, I think that's a policy decision for council. I think as we did phase 1, council was comfortable with doing the in lieu fee for permanently affordable housing. So now we're at phase 2. So the question is council comfortable with that? Right now we have the commercial linkage fee, which goes to affordable housing, obviously, but this would be new territory. So if we create a requirement for on-site commercial, then the question is, should we create an in lieu fee or should we just keep it with the commercial linkage fee? And then secondarily, it's should the, if there is an in lieu fee based on that amount of square footage, should the off-ramp option be available? Or it could be just commercial linkage fee.
So does that mean, I think part of my question is, do we have the programming for that? Because I understand with residential affordable housing that we are, that we have the programming for that, but do we also have the programming for that as well for commercial, or is that gonna be like a new project that will be set up just for?
Yeah, it would be set up through this project. This is new territory.
Thank you.
If I could just, and I'm apologizing for not having my camera on because I don't want to lose connection. I also want to introduce everybody. I think you've met him before, Mark Wolf, who is helping to lead this effort as well. This is Yvette Bowden, Assistant City Manager and Director of Community Vitality. Junie, thank you for your question. You'll be seeing us back, I believe, in May on the retail strategy with an update for you, and then later on the business support programs, and that's where we look to finalize how that would roll out in concert, and we appreciate the collaboration of Carl and Charles and everybody on the team so far. So some of it exists today and would be enhanced, some of it would be new.
Thank you so much.
Is that it, Junie?
Thank you, Sam. Thank you.
Okay, super. Then we've got Mark, Bob, Mary, and Mirabai. Mark?
Yeah, I want to start with just a comment on Junie's comment in response to in lieu fees. In housing, we do it because there are sometimes financing or other logistical issues with providing on-site affordable housing. None of those issues are really present in commercial context, and I think it argues a little bit against having an in lieu fee in that context. In terms of questions, my first one is the community benefit structure supposed to be in lieu of the entire linkage fee for a project, or just the increased linkage fee allocable to the additional height?
I think what we're recommending is that there not be an in lieu fee for affordable commercial and an increased commercial linkage fee at the same time. There would still be a commercial linkage fee applied to the non-residential space below the height limit.
Got it.
Above the height limit, you have that increased rate.
Okay.
Recommending that we not have that and the in lieu. You could have the in lieu for the off ramp and keep the commercial linkage fee, but not
okay.
In lieu fee at the onset of the project.
Okay. My next question arises out of a concern about picking winners and losers through the program. If we have 2,500 square feet of commercial space, affordable commercial space, and we have 5 applicants who might meet our criteria, how are we going to select one above others? I'm a little troubled by having our economic vitality department making those selections. And I don't understand what criteria we would be using to make those selections.
And maybe.
And the secondary question is, if we're standing up a whole new regime to manage and deal with these kinds of issues, how much additional staff would we need? That's the lesser question. The larger question is, how exactly are we going to use our governmental agencies to pick and choose appropriate tenants for commercial projects if there's more demand than there is space?
I think the thought process was that, just like affordable housing, an applicant would come in and they would have a tenant in mind for the space, and that we would review it through the process to make sure that they're eligible. I might have to turn it over to Community Vitality to talk about the ongoing, election of who goes into the space. And I think they find at this juncture that they would have the staffing to handle these. But obviously, if we see the frequency of these increasing, there might have to be a need for additional staff.
Okay, well, let me give you yet another kind of related question. Have we done any kind of survey of what our arts groups are paying now? I mean, if you look at say the 2019 retail rates, you discount them by 25%, you end up somewhere in that $20 a foot range. And as I understood the program, the developer is not obligated to give away free rent, and he's not obligated to give away tenant improvement allowance. And so how many of our arts groups, for instance, I regard them as sort of the most vulnerable of the candidates, are prepared to pay $20 a foot rent and not get any free rent and have to develop and fixture their property? And so have we done any canvassing to make that determination as to what they're actually paying now and whether they can step up to these levels?
We've done a fair amount of outreach to the arts community. I don't know that it got into the details of what they were paying and things of that nature. I think obviously this report is relatively fresh, so I anticipate talking to the arts community about the findings.
I'm just urging you to take a look at that, because I'd hate to set up a program that the arts groups can't afford, and we're looking to provide affordable commercial space for arts groups, among others. Last question for the moment. With respect to Appendix J, the FAR increases that you propose on a zone-by-zone basis seem to be all over the lot. It's 62% over the base FAR in DT4, 40% over the base FAR in MU1, 52% in DT5, and 33% in Uni Hill. What's the operating principle?
Well, to be clear, it's not increased above the existing limit in DT4. The logic for the other zones is that it was basically looking at any of the zones that have around a 0.5 or a 0.6 or 0.67 FAR and just increasing that to 1.0. That's what was done in a number of zones in phase 1. So we were just applying that logic to other zones that have that same FAR limit.
Understood. Okay, thank you.
Thank you, Mark. Next, we've got Bob, Mary, Mirabai, and Rachel. Bob.
I have two questions, one as a follow-up to Mark's and one's a follow-up to Junie's. With respect to the comment that Mark just made about arts community, I'm sure the math works out as far as these discounts on rent, and this being fair to a developer, and maybe that's a point of agnosticism for them. But if we haven't already, I really encourage us, before we bring this back, to go out there and figure out what these communities are actually, these prospective tenants are actually paying. In other words, I think if you said to the arts community, hey, would you like to have discounted rent? The answer is going to be yes. And then if you said, hey, would you like to have discounted rent at $20 a square foot? They may say, oh my God, no, I got $12 a square foot right now. So I just like to have an understanding about what the reality is, because these numbers look swell, 75% of market rate or 50% of market rate. But many of the prospective tenants may already be paying effectively 75% or 50% of market rate, because it depends on what market you use to apply the discount to. So I'd really, if you haven't done it already, I really encourage you to go out to the types of tenants that you're talking about here and find out what they're actually paying in rent. If you know that, that's great. And if you think there's going to be a land rush for these types of spaces, that's great. But what I'd hate to do is go through all this effort and then have someone put up a building and have no one show up, and they sit there for the requisite 3 years. So that's just I guess more of a comment or a request for information following on Mark's. With respect to the in lieu, the 50% and 75%, those are caps, right? In other words, a landlord could, if it wanted to, charge less than those amounts. Is that correct?
I believe so. Yeah, it would just be a cap.
Right. And so the landlord builds the building, they build it tall. They set aside, let's use the 9%. They set aside 9% of the bonus floor area and put up a big sign that says 25% off market rate, come and get it. And no one shows up. And so they start to reduce the rent? How about 30% off? How about 40% off, 50%, whatever? Because right now they're not collecting any rent, right? And they can't rent it out at market. At some point in time, they're going to hit the 3-year mark. Is that off ramp? Is that discretionary? In other words, is that they can come to the city and say, you know what, I tried for 3 years. I'm giving up. I'll pay the fee in lieu because I've done the math on this, and it's better for me to write the city a check and then being able to go and then being allowed to go to 100%. Or do we force them to pay the fee in lieu if the properties, those relevant spaces sit empty for 3 years?
Basically, we wanted to build some flexibility into the program. So if somebody is really struggling to get someone in that space, we're proposing that they would come in with an administrative review, and they would have to show some due diligence of how they've been trying to get tenants in there. And if they can demonstrate that, then it would be that they would just pay the full in lieu fee to exit the program.
That part I understood, but I'm trying to understand whose option is it? In other words, could they, if they didn't want to do that, could they go to could they have the property sit there empty for year 4 and year 5? Or are we going to force them out of the program if the relevant space sits vacant for 3 years or more?
If it goes more than 3 years, there would be penalties that apply. So if they're willing to pay those penalties because they really want to get someone in there, that's their decision. If they, after 5 years, then determine that it's still not working, what the proposal would be is that we would deduct those penalty fees from the in lieu fee payment to exit the program.
Okay, so let me try to play that back to you. So during the 3 years where they're having difficulty, during those 3 years having difficulty, they could come to you and say, you know what, I want an off ramp. I'll write you a check. How much is it? And they're out of the program. If it goes longer than 3 years with vacancy, you're going to start imposing penalties. Is that right?
That's correct.
Okay. And is it in other words, I don't know we're getting in the weeds here, but you want us to tell you what to draft. So I'm trying to ask some questions. Is it 3 consecutive years? In other words, if they have a tenant in there for a couple of years, the tenant moves out, does that start a new clock running?
I believe it would. I mean, because we would be monitoring, when the tenant change outs occur. So it's when the tenant stops operation in that space.
Is there a minimum tenancy? Like you say, it's got to be at least 6 months or a year or something like that?
We don't have that in there, no.
It just seems to me there's a lot of ways to game this, right? In other words, you get your brother-in-law to come in there, you charge him $1 rent, he's there for a week, you start a new clock running. Since there's no minimum rent, right? So they can charge his brother-in-law $1. He could be in there for a week since there's no minimum tenancy, and it starts a new 3-year clock running. If it's to their advantage to have the property sit empty, which obviously defeats our purpose of trying to find inexpensive space for nonprofits, then it seems to me there's a lot of ways to kind of game this. I just want to make sure that we've thought about all the possible permeations here, and that the penalties and the off ramp work. You might want to give some thought to whether you want to have a minimum rent. You want to give some thought to whether you want to have a minimum tenancy. I don't know. I don't want to over-engineer this, but it seems to me there's a lot of ways for people to get out their calculators and figure out what's best for them, which may not be what we're trying to achieve here.
That's a good point.
Okay. That's all I have.
Mary, and then Mirbai, and then I will go.
Thank you, Sam. I have kind of a combination of questions and comments. On the BR1, where we're looking at the 1 unit per 1,600 square foot density. Have you thought about other zones in which there's a similar problem presents itself?
Yeah, I mean, it comes up in a lot of the higher density zones that have that same 1 per 1,600 square foot limit. There's a lot of zones that have no limit at all. So I think in our mind, obviously there's a lot of other regulatory factors that keep a development in check in terms of parking, traffic, bulk, and height, and landscape requirements, open space requirements. But if a developer can't build a certain number of units, they're just going to walk away. So there are certain zones where it's very flexible, you know, where they can do as many units as they want. And there's all these other factors that keep the development in check. BR1 is one of those areas where we want to direct some of those units, and that is a big barrier. So we'd basically just be waiving that for permanently affordable projects and making it not unlike some other high density zones that we have in the city.
Great. And I'm just wondering if it might be worth, as we go through the site review criteria, to look at those other zones where there is, you know, the minimum square footage per unit, and if it might be beneficial to reduce that square footage through the provision of affordable housing. So it's something to consider and perhaps look at as we move forward.
And we're also recommending BC zones, because they both the BC zones have an open space per dwelling unit requirement and a 1 per 1,600 square feet of lot area that could also be limiting. So you could apply that, and that's what we're recommending for the BC zones. It may be at a future time, but that's something we put out there as well.
Okay, thank you. And then mostly I'm going to be asking questions about the site review criteria. Is that okay?
Sure.
All right. And then, so in the site review criteria section of the memo, there was a suggestion to remove the first criterion, which is a reference to the Boulder Valley Comprehensive Plan. And then there's a couple of questions, or one of the suggestions that was made was that's because the master plans kind of cover some of the policies that come up in the comp plan. So I'm wondering how you would reconcile the fact that the master plans would likely be changing at a faster rate than the site review criteria. So how would you reconcile those two things?
I think what you're referring to is removing the language on balance. Is that your question on the policies?
No, there was a comment about removing the criterion about the Boulder Valley Comprehensive Plan.
No, I mean, we're not looking at removing that criterion. It would still be in the criteria. It just would be made more specific. The way it's written right now, it mentions just broadly that it meets BVCP policies. I think what we're trying to do is be a little more specific to some key policies instead of, one of the things we keep hearing from the community is obviously through the site review process is making this more predictable. And one of the more challenging criterions in terms of predictability is that one that talks about on balance. Because like there's so many competing policies that an argument could be made for or against any project. So we're looking at trying to make those Boulder Valley Comprehensive Plan criteria a little more specific to key policies like affordable housing or environmental protection, rather than having that on balance statement. Have a criterion in there that requires consistency with any area plans. So we're not looking to remove that, just make it more clear.
Okay, good. And I really, when I read through the removing the on balance, I thought that was a really great idea. Let's see, on the language, updating language, I think there is some real outdated language within what we're looking at. And I was wondering, another question is, have you given any thought to perhaps having Amy Kane and the racial equity group look at some of the language and make sure that it meets some of those goals?
I have been working with that group. We are looking at some ways where we can try to address the racial equity plan through this project. It's still unclear kind of the legal grounding for it. So we're still keeping that option on the table. It might come up through the community benefit piece, or it could be coming later in the site review criteria, but we'll definitely talk with them more about it.
Okay, great. And then moving over to a question about the affordable commercial space. One of the arts and culture businesses that could be allowed perhaps in the affordable commercial are art galleries. How would you address, like, say, I mean, what if Sotheby's, for example, wanted to come in and have an art gallery in one of those spaces because they're an art gallery? How would that be looked at and evaluated?
We have talked about this. I mean, if the space is purely an art gallery, it would be considered retail sales. What we've tried to incorporate into the definition for art is that it would only permit accessory sales. So it can only be an accessory component of another larger art use.
So in other words, it might be like a, I don't know, a craft store or something, and they have art for sale additionally.
Yeah, we're thinking like it could be an art studio where they make pottery or something, and most of the space is allocated to the actual studio, but they could have some smaller area of that space where they sell the pottery. That would consider accessory sales.
Okay, got it. Thank you. Let's see. There was in the site review under site design and open space, in that yellow section, there was a comment about for larger projects of 100 or more units, or only require open space buffers on lots next to city open space or parks. What does that mean?
Well, I think one of the issues we're dealing with in the site review criteria, and thank you for reading that whole section also. Basically, there's a lot of criteria that come up for smaller projects where we're like, oh, this is more like what a bigger project is trying to accomplish. Like if it's the bigger project is going to have an impact on the smaller project, that there's some sort of buffer. Or one of the criteria we have is like a project that has a certain number of units would have to provide active recreational uses. You know, that wouldn't apply to a smaller project. They're not going to be able to put in a pool or a tennis court. So in trying to make the criteria more predictable, we're trying to put more measurable metrics in there, like threshold when this particular criterion would apply. So I think that's what you're asking is, you know, there might be a case of a larger project that needs to be buffered from a smaller zone next to it, you know, that allows less density. There should be a buffer.
But I guess the part that's confusing me is open space buffers on lots next to city open space or parks. So for big projects, you would provide them more buffers because they're next to open space or parks?
Well, there's already a criterion in the code now about how something transitions to a city park or city open space. I think we're just trying to be a little bit more specific about what that buffer would look like.
Mm-hmm. And the current building setbacks wouldn't cover that transition?
Not always. I mean, it depends on the zone.
Uh-huh. Because to me, it seems a little bit like double dipping, but just a comment. And I think that is all I have. And then finally, a question on Appendix J. In Appendix J, we decided that it would expire in May of 2021. Is that correct?
That's correct.
And then could you remind me what the conversation was like the last time we touched Appendix J? As I recall, we were trying to figure out whether it should become permanent or what we should do exactly. And
yeah, I mean, the options for council are that it could remain in place as it is right now. We could extend it, or it could be repealed, which means that then the height modifications could be requested citywide, or it could be modified where you add to certain areas or subtract from certain areas, add more zones. Those are the options. So I think with this particular check-in, we provided more information to council to be thinking about that change. The zone by zone analysis, that wasn't completed at the last check-in. So there's more information there just to help with that decision. But again, we're not asking for a decision on that tonight. But if there's, a certain additional information that council would need to help with that decision, or if council wanted to give us an idea of what we should be working on for the ordinance, that would be helpful.
okay. Thank you. And that's all I have.
Great. Thank you, Mary. Mirabai, and then I'll go.
I just had a few more questions, just on statements. To Bob's point, I think that if we're going to be working on this, we should make it as foolproof as possible, as strict as possible, so that, as he was saying, we can't rent it to your brother-in-law for a week. And we have a chance to actually do something that's possibly, in some people's eyes, going to provide community benefit. And if we're going to be doing this, we should make it as absolutely foolproof, so that people can't jump through hoops to play the system. So just a comment on that. Second, I guess here's one question. I think that we've been played a lot in the past about community benefits, and obviously the one that's always used the most is the development on Pearl Street. Is there a way with doing this that we can stop developers from doing cash in lieu in the last minute after, we think they're going to be doing one thing and then all of a sudden, because again, I think cash in lieu is the last option. This isn't what we're really truly trying to get at is, getting money. I think what we're really truly trying to get at is some affordability in whether or not it's residential or retail. But does staff know, is there a legal way, something that we can do to make sure that if they're going to do cash in lieu, we know it's happening up front versus thinking we're going along the project and then boom, all of a sudden something changes and all of a sudden they have to do cash in lieu?
Well, I think this project is different than that Pearl Street example because at that time there was no actual community benefit requirement. So there was no recourse at all. They could promise something in the development, a use or a space, and then after the fact, they could put something different in there that's consistent with the site review, but there is no community benefit requirement. So in this case, there would be a community benefit requirement. I don't know that we can necessarily prevent them from later doing an in lieu fee. If they're really honestly struggling with keeping a particular use in that space, we think it's appropriate to have an out for them, but at least at the end of the day, there would still be a payment that would go into something that would fund affordable housing or affordable commercial spaces, where in that site review example, there was no recourse.
No, and I understand that part, but where I'm going with this is I understand down the road if they can't fill the space and they have to go cash in lieu, but I'm talking about right after the development. So they say they're going to come in, they're going to do some form of community benefit, and then the whole building gets built, and then all of a sudden, oh no, I'm sorry, we can't do that here. We're just going to pay into it. Is there a way right during the development, that we could cause that to not happen? Does that make sense?
Look into that a little bit further. I think that's why in the KMA report, they suggested the full in lieu fee. We're trying to look at monetary, ways of trying to avoid a situation like that.
Okay.
Could I colloquy on that question?
Yeah,
Sure.
but then I have more, so.
Okay, yeah, just really quickly, I guess, Carl, the question would be whether if a developer is proposing, an on-site affordable commercial, could you make it a condition of approval that they execute that promised on-site? Since we would have the community benefit ordinance to back us up.
I think that's the intent of this, is that with every site review, that's what'll be different, is that there would be a condition of approval that would hold them to some sort of, to meeting the community benefit requirement. Again, I think just down the line, there's still, I think there needs to be some flexibility if they can't make it work.
Oh yeah, I'm not addressing that. I think Mirabai is getting at the initial bit, right? That they have a site review proposal. It includes on-site commercial, and then like the day after they get their building permit, they say, you know what, let's just write a check.
Well, I mean, the thing is that what we've been talking about is that they have to demonstrate that they've used due diligence to use the off ramp. So we could have that they have to at least try to market the space for a certain period of time. I mean, 3 years or.
Yeah, so I'll just throw in one quick comment and that later might give it back to Mirabai. That's worth considering in the program about ways to essentially require them to stick with their commitment at site that they made at site review for at least some period of time. Thanks, Mirabai.
Yeah, of course. So I just have 2 more questions, and I don't know if this is possible. Well, 1 more question and a statement. I don't know if this is possible to answer, but I'm going to jump us back to Gun Barrel. Do you know, in the past, I'd prefer 10 years, but I'm sure that's kind of a difficult question to answer on the fly, but I'll just ask it that way. Do you know in the past 10 years how many height modification requirements or requests came in for the BR2 area in Gun Barrel? That's in Appendix J right now.
I don't believe there have been any, to my knowledge.
Okay. All right, then that's where I'll leave it right now.
Super. Thanks, Mirabai. So I will go now with a few questions. My first one, since we have Kaiser Marston folks here, I will turn to them and ask, are there other communities that you're aware of or working with who are looking into affordable commercial? I know that lots of folks look for affordable housing, but I was curious what your experience with this in other cities might be.
I think it is a pretty unique program that you're embarking on. I know that Portland, Oregon does have kind of a pilot program that Carl is aware of, but aside from that, I'm not aware of another one. It doesn't mean there isn't one, but I'm not aware of one. I don't know if Kevin Feeney, also Kaiser Marston, if you are.
No, not structured in something so standardized. There's other communities that have negotiated affordable commercial for a specific development, but not as part of a standardized program like what we're proposing here.
I see. And since you probably talk with other city planners and planning departments a lot, do you hear conversations in high rent cities and high cost cities about doing something about preserving small businesses? And what have you heard for other ideas for achieving the same ends?
I think there's other cities that have. I don't know if I have any brilliance to bring you, to be honest with you, but there's like small business assistance programs and things of that nature. Nothing about delivery of space quite in this nature. In California, we've had these redevelopment agencies that would be sort of project specific assistance with conditions around the delivery of those specific development projects, but not, I guess, as a broad citywide policy like is being contemplated here, or policy that would be open to developments within specific zones.
I think the other area where, not just for small businesses, but for nonprofits as well, I think there's a growing concern in a number of communities on displacement of nonprofits, small businesses. And I think the other approach that some communities have experimented with are acquisition funds for nonprofits, small businesses, arts organizations to purchase older spaces, which requires a funding source of one kind or another. But because it's already built space, the values are a little bit less. So the actual subsidy that you have to put in is not terribly significant, and it provides meets the same objective of long-term affordability, but in an ownership model, and we've seen that here in the Bay Area in a couple of cases.
Super, thanks. Those are great answers. Appreciate that perspective. Then back to Carl. Talking about replacing the additional commercial linkage fees. So we're talking about bonus floor area in higher intensity buildings. You talked about replacing the commercial linkage fee with either in lieu or with affordable commercial. Did I get that right? Because you're talking about saying no additional affordable housing linkage, we'll use these other things, correct?
That's correct. We're basically just trying to avoid an unnecessary redundancy in the ordinance. There might be, you pay commercial linkage fee for the first 3 floors, and then to have 2 then options for in lieu of affordable commercial space or the commercial linkage fee just raises questions about where does the money go? How do we actually get a successful in lieu fee program for the affordable spaces? So it just makes sense to, if an in lieu fee is going to be created as something that they could request when they come in with their application, then we would recommend that the commercial linkage fee be taken out, the additional. We're not saying that precludes the off-ramp option, but it just seems odd to have 2 different options for how to pay for that extra space.
I agree with that. So just to make sure that I'm tracking, if there's a building that's 100,000 square feet and we've got $30 a square foot, commercial linkage fee is kind of our standard, then that building would pay $3 million into affordable housing, right? So the base commercial linkage fee, $30 a square foot, would apply to the entire building. And then in the bonus area, that would be used for commercial only. So either affordable commercial or in lieu for affordable commercial. Is that your proposal?
Yeah, I mean, phase 1 would be you pay the 43% higher.
Got it.
Fee,
okay.
Equivalent to that would have to be an in lieu fee that would go into affordable commercial.
Got it. Okay. No, that clears it up completely, because I agree. And I see the point now. I just wanted to make sure I understood the proposal. So thank you for that. And then I could ask a bunch of questions along the lines that Bob did. And I think those are very interesting questions. But I think it's well worth taking a look at what the demand is for these discounted spaces. And so it's just a comment about what would be helpful to come back with, because it is my sense, having, searched for as cheap a commercial space as I could find over the years, that if you're offering discounts of 25 or 50% off of market, you will have a line of people wanting to get into that space. Now, a difference here is I was always looking for kind of more warehouse flex space, and this, a lot of it might be commercial because it's in newer buildings. So I would just have you can talk to the arts folks, but this brings up a kind of an existential question about program design. I think what small businesses might be able to afford and stomach, you might have a long line of people from startup small businesses who'd be very excited about a discount, but it might not be good enough for art spaces or for nonprofits, because they might have even more restricted budgets than small businesses. So I think there might be a challenge here wrapping those all up together. And because you may have different budgetary requirements from those sectors. So I agree with Bob that it's worth asking, but you probably want to look at all 3 main sectors that you're talking about, which would be cultural spaces, social services, so nonprofit, social services, and small businesses, because it could well be you would have one of them jumping at some program where the other two might not be able to. So that's just kind of, when you come back, it would be very helpful if you've learned like what each different segment would require. And then I wanted to get back to Mary's question about anything that has to do with dwelling units per land area or open space per dwelling unit. I won't go into all the different zone districts that have it, but I would just point out that it's well worth, I think, if you bring us back the site plan review criteria proposals, when you bring them back to us, I really think we would want to know all of the zone districts that have that form of perverse incentive to build larger units. Because I think, you know, at the end of the day, the reason that I, for instance, find that to be a objectionable way of doing land use is you end up getting bigger dwelling units, even though you'll have the same intensity. So that was just a request for more information when you come back. If you could flesh out for us what all of the zone districts are that have that kind of requirement. And then, so the other question I've got is, you've got some requirements for the kinds of entities that might want to use these affordable commercial space, and you've outlined them pretty clearly, but I could easily imagine something that doesn't fit neatly into one of those categories, right? There could be an enterprise of some kind that doesn't fit into the categories that you've listed and the criteria that you've made. So have you considered how to think about those? Like, would you have a staff level review that could be called up by planning board? Like, how would you do all the other stuff bucket that don't fit neatly into it, but might be things that the community's interested in?
Well, I think we'd have to look at it. I mean, the phase one piece has the alternative community benefit option. It might be something that could fit under that. And then we would bring that through the process through a discretionary review.
I see. Okay, that's a great answer. I've got some comments, but I think that's all of my questions. So we got 4 hands now. We got Adam, Mark, Junie, and Mary. Adam?
Is there going to be a specific comment period? Because mine is just a comment.
I was going to try and have a separate comment pass, but it's up to council. Do other council members still have questions? Mark, Junie, and Mary, are yours questions? The comments mostly? Okay, so comments. Adam, lead us off with comments.
Thanks, Sam. So my biggest concern definitely is one that Bob brought up, which is essentially gaming the system. And my suggestion to that is bringing in a couple of trusted developers, maybe a former developer council member, and a couple of planning board members, sit down in a Zoom meeting for 4 hours and literally poke holes in every possible outcome. Because I can think of a few just off the top of my head. You know, somebody starts an LLC that has 2 employees and no income, but then contracts out to a major company and they utilize the space somehow. Something along those lines. You know, there seems like there should just be a step in this process that is literally poking holes with a wide array of people in the room. That's my major suggestion for feedback at this time.
Super, thank you. Mark?
Yeah, you know, I was the council member who was not supportive of branching out into this area, but as it is the will of council to do this, my interest is in getting a robust community benefit. And I think my major concern with the program as it is currently constituted is I think we're shorting ourselves. I took a look at you know, the Daily Camera building, which has a bonus area of 29,580 feet. If you do a new construction, let's assume you're doing an office and you can rent that space out probably for $50 a foot. And if you can do that, you would get $1,479,000 of additional rent for your bonus area every year. In contrast, you've got 2,600 square feet plus minus of affordable commercial space. And let's say probably at the maximum, you're going to get a discount of $20 a foot to what the landlord could otherwise rent it. And that would be about $53,000 a year. So if you compare those numbers, the landlord's getting almost $1,500,000 a year, and we're effectively taxing him at about 4% for that additional income. I think we're shortchanging ourselves in terms of the benefit we ought to be getting for the revenue benefits that we're conferring. And I can't tell you exactly what that right number ought to be, but effectively taxing the landlord at a 4% rate. I'm a developer, I'm jumping up and down and throwing a party for the privilege of getting that bonus space. A couple of other comments with respect to Appendix J. I'm fine with the Ball Aerospace and Diagonal Plaza. I am concerned with greatly loosening the strings on Gun Barrel. And my general approach with that would be, my notes from the last meeting remind me that the outreach performed by staff indicated that 60% of respondents were not in favor of height modifications and only 25% were. This doesn't mean there should be no modifications of Appendix J, but it does argue a bit, A, for more community outreach, and B, for a cautious approach, and let's do some modifications and see how things go. So Diagonal Plaza, Ball Aerospace, a couple of other areas are probably appropriate to expand the map, and let's see how it works. But I'm not really in favor of a broad-based revision of Appendix J when we don't know what that impact is going to look like. But again, my biggest concern is I don't think we're getting enough community benefit for what we're giving away. And we're giving away, 2 top floors, premium space, and we're getting, a very modest amount of affordable commercial space under conditions we're not even sure what they're going to look like at this point. And I want to also second Adam's comments on looking at ways to prevent gaming the system, because right now this thing has many, many, many holes in it, and it doesn't mean it can't be tightened up, but it needs to be tightened up. Thank you.
Tom, I see your hand. Would you like to respond to something?
It concerns me. This is not a tax, it's a fee, which is why it's constrained, which is why we have a consultant working on this. I be very careful about using the word tax. Taxes require voter approval. I
am using that in a more colloquial sense. We are essentially charging the developer a rate of 4% on the amounts of revenue that we are providing him. It's not really a tax. It's simply the fee that we are charging is 4% of the revenue. And my comment is that I think that is awfully low for the benefits that we are conferring upon the developer.
I just urge caution using words
I will use any language you desire, but the economics are.
The desire you call it a fee, because that's what it is. It's not a tax. And the line between a tax and a fee in Colorado isn't all that clear. So we work really hard to stay on the fee side of the line.
I will use your recommended language.
Thank you.
It is a fee. It is a very, very small fee. And that's what I'm commenting on.
Thank you.
My pleasure.
Junie, Mary, Aaron nearby, and Rachel. Junie.
Thank you, Sam. I wanted to go back because I did have one question that I wanted to ask, because I'm still trying to find the advantage of having cash in lieu when it comes to affordable. And my question is, from my understanding of cash in lieu when it comes to affordable housing, do you know if, for instance, developers would face the same financial challenges when it comes to getting loans? So I'm trying to figure out why is having this cash in lieu is advantageous? Or are there any constraint to having those, the commercial affordable in the same space as market rate?
I mean, I know that, you know, affordable commercial is something that the community has said is a primary community benefit. And so that's the approach we've taken with this, and trying to make it similar to affordable housing. But I'm not sure, maybe I'll pass it over to Community Vitality on whether the spaces it would be beneficial to have them together.
Sure, I'll take a crack at that. I think there's probably very few instances where in lieu would be appropriate. I can think of areas where the business mix might not be appropriate for a retail tenant, for instance. But given the uncertainty in some of the details, we thought it was important to leave a certain amount of flexibility.
Yeah, thank you. I didn't feel that you answered my question, but again, it might just be a hard question to answer because, again, we're just trying to figure this out together. I would say for right now, I don't understand. First of all, I just wanted to go back. I think Mark mentioned earlier whether Community Vitality will have the bandwidth to implement a program like that. And so far, I didn't hear anything that proved otherwise. And also, from my understanding from Carl, it is up to council. So it is, you know, it is not something that, I don't think the advantages have already been fleshed out in a way that would tell me to say yes when it comes to having the cash in lieu. And when I think of, again, you mentioned the advantages of having small businesses or market rate and affordable commercial in the same space. And I was just thinking to myself, in a time right now where, for instance, we're dealing with economic crises, and if you have, you know, small businesses or businesses that need the help in the same building or in the same building as a market rate, you know, there's probably more traffic, and that probably will help a small business if they're in the same area as a more affluent business. So I think having that diversity within that same building, I think, is important. So I think because of that, and I didn't fully understand the advantages of the cash in lieu. So I would say I would not support it. And I think Mayor Bai mentioned something earlier about having probably more constraint. I don't support the cash in lieu, but I would support it if there were more constraints to it, basically.
Sam, can I respond?
Sure, Tom.
So I don't want to drag this out too far, but one of the reasons we allow cash in lieu is to avoid a takings claim. If the person can't do it and then they have to leave the space empty, so there's no viable economic use, we could be subject to a takings claim. The cash in lieu gives them an alternate, so there's never a possibility of a takings claim because there's always some valuable economic use of the property. The other thing is these restrictions are untested in the courts, and we'd like to keep it that way. Our affordable housing program has worked successfully for many years and has never been challenged in the courts. We'd like to avoid that. Giving developers a somewhat easier out that's just a money thing they can pencil in helps protect the program. So those are two reasons we've always advocated for a cash in lieu, but obviously it's your choice.
No, thank you, Tom. I think that's really helpful to know that. Thank you.
Thank you, Tom. Mary.
So kind of thinking about the line of questioning that Junie just had, one of the, in trying to make the in lieu option more, bring it into alignment with affordable housing cash in lieu, one of the advantages of the cash in lieu and affordable housing is that it is then leveraged to get more affordable housing. So if we can think about how we might be able to take that in lieu money and use it to somehow leverage more of something else, maybe what it goes into is a tenant finish loan and that is paid back. And maybe it's always a fund that is available for tenant finishes in those affordable spaces. So that's just kind of trying to think about how that in lieu can be leveraged in a similar manner as the affordable housing in lieu's. And like Junie, I think I could support it if we can figure out a way that it is leveraged in such a way. And then I just wanted to add that I support Adam's idea about getting a group together to try and poke holes in this. And I think as we move forward, I think it's important to keep in mind that what we don't want to do with this program is cannibalize affordable housing. So above everything else, we want to be able to have affordable housing. And this needs to be sort of just another option that does not make it easier, I guess. Anyway, I think you understand what I'm trying to say. And then with respect to Appendix J, I would like to know more about how, so one of the reasons that Appendix J went into place, as I recall, was that there was a lot of construction going on all over town, and it was a big boom, and there were these buildings that were going up to 55 feet everywhere. And so then came Appendix J. And so if we were to lift Appendix J, as we have said we're going to do, I'm just wondering, would that just kind of reignite that boom that was going on then? So I'd like to know if there's, to what extent there is that demand that would suddenly, we left Appendix J and suddenly we'd be right back where we were prior to Appendix J. So I want to know more and to decide whether or not it makes sense to just lift it all at once or to do it in a phased manner that addresses needs that there might be out there for development and balance that with not having a rush on a bunch of building construction. So that's all I have.
Mary, would you mind if I colloquy just briefly?
Please.
Just on the history, I believe that the concern that we expressed back then when we were talking about the building boom that was going on was that there was no community benefit. So if you recall at the time, we had no commercial linkage fee. And that the complaint that I recall, that I was one of the ones making it, and so were you, was that this building boom was going on and there was no benefit recapture really of any kind. There was no commercial linkage fee and there was no affordable commercial or the other options for space. So I just wanted to put out there that I think that the complaint at the time was that commercial buildings which were going up did not contribute back in the same way that residential did. So I'll just put out there, that was my recollection.
No, thank you for that reminder, Sam. Appreciate it.
Can I add a bit as well? You remember, I think you did Appendix J originally in 2015.
Yeah.
It's been extended twice in 2017 and 2019. In 2019, you added community benefit requirements to the height permissions in Appendix J. So what Appendix J does is says you can only go to 55 feet in these specific areas. Originally, that was it. And then in 2019, you added a requirement of 40% affordable housing to get that benefit. If Appendix J expires, what will happen is that will apply through the city. So throughout the city, you could go to 55 feet if you had 40% affordable housing. So that's what would happen if you don't extend it to March 31st.
Great. And Tom, just to follow up, if we approved a community benefit ordinance that had alternatives to the additional rate on the bonus area, then we would have effectively required community benefit anywhere in the city.
Yes.
Okay, thank you. Aaron, Mirabai, Rachel, and Bob. Aaron?
Right. So thanks everybody, staff, for your hard work in putting together a comprehensive proposal on some complex issues. And I appreciate Kaiser Marston's assistance as well. I'm going to try to walk through your questions really quickly. I mean, I do think that you're going in the right direction with this. I was impressed by the analysis, and I feel like you're on the right track. I'm really glad that we are adding affordable commercial and arts and nonprofit spaces to our list of potential community benefits. I know there's some folks who've been working very hard for years for the arts component to be a piece of this program, so appreciate their advocacy and that we're getting somewhere on that. So yeah, I think we're going in the right direction. For your number 2 about the non-residential projects, I think what you're talking about with the in lieu is fine. I appreciate Carl's points about you want to make sure that you have an economically viable space and that we give people an out. But to Junie's point about that, what we would most like is the on-site affordable commercial. Maybe we can have some criteria that people have to walk through before they could pay an in lieu fee. So instead of it being 100% just, oh, I'd prefer to write a check, that we could say, well, you have to at least say that there are a couple of reasons why the affordable commercial wouldn't work in your particular project. And then if that's the case, then you could do in lieu instead. So I'll just put that out there, and you can think about whether that's viable. Tom, you could maybe talk to them about it, but see if maybe we could put some guardrails on that. Could we go to the next page of questions, please? And your off-ramp is fine. On the Appendix J map, Sam, I totally agree with your memory of it and analysis of it. I mean, it was a little before I got on council, but I remember following it closely from planning board, is that the not allowing for height modifications was while these community benefit projects were undertaken, right? The linkage fee, and then followed by the community benefit requirements. And we're coming up on 5.5, 6 years later, and wow, the end is in sight, of these projects. And so then my understanding of the intention and what makes sense to me is that with these forward-thinking and pretty comprehensive community benefit requirements, we could let Appendix J go away, because it would just mean that you would be able to offer community benefits throughout the city in return for a slightly larger or taller project. And if people do some of that, then we get additional community benefits, which is something that would be beneficial by definition to the community. So I would advocate for letting it lapse, since we're finishing the project now after about 6 years. And then I would not undertake a separate view corridor protection ordinance. I think we've done that well when we've done particular area plans like Boulder Junction, protected particular views. But I think it requires that level of really detailed site analysis to do that well. So as we do some more detailed area plans over the years, like we're doing with Alpine Balsam, or like we might do with futures in the future, we could add in some view protection requirements to those very specific area plans. But unless we're doing that level of analysis, I would not do a general ordinance on the topic. And I wanted to congratulate Mary as well for her detailed review of the site review criteria proposals. I have to confess that anticipating we were not really talking over those details, I didn't get to that level, but I look forward to the discussion of the site review criteria details later on this year when we get back to it. That's all I got.
Thank you, Aaron. I'm going to give you the prize tonight for being the most direct and concise. Congratulations. Mirabai, Rachel, and Bob.
So can we go back one page just to the first part of the questions? Thanks. So my comments on this are just going to be that I appreciate staff's work on moving this forward. I also think that adding in the arts is fantastic. I'd love to see more affordable commercial space for some of our specialty areas of this community that struggle with the high rents that we currently experience. In general, I'm not a fan of linkage fees, period. I think it's an easy buyout. I understand the legal necessity for them, as Tom explained, but I have a hard time supporting much of them. So I'm not quite sure the workaround, but I do think a lot of this needs to be tightened up quite a bit. I think there's way too many outs where developers can wiggle their way around things. So anything we can do to increase protection that we truly get what we're going for here, I would like to see. I'm not a fan of getting rid of Appendix J. I won't support that. I think that there's too many in this community that are concerned with the height modifications. And I think that there's many people who it doesn't matter, and kind of myself included, that there's not a lot that can cause me to want higher buildings in this community. There's not a lot you can give this community that I think warrant having higher buildings. I'd prefer to see us subsidize arts and work on using linkage fees in a different manner to create more housing, rather than continuing to build higher, and especially in areas outside the Appendix J map. Even though it sounds like Gun Barrel has been removed from having too many requests for height modification, I'd like to see Gun Barrel taken off of this completely per residents' requests to me, just because, one, I think a lot of people didn't feel like the engagement back in August even represented their questions, but two, until a sub-community plan can be done for the whole area that creates a robust community engagement, having that on the table makes many of the residents here feel quite uncomfortable, especially as many of them are in the county. And so if Appendix J were to go away, I guess I may support a view protection ordinance, but for right now, if Appendix J stays in place, I think that I would be okay with not having that be implemented. So I hope that gives enough clear guidance for staff.
Thank you, Mirabai. Rachel and then Bob. Rachel.
Thanks. I wanted to clarify, Tom mentioned a March 31st sunset date, but are we really talking about May 31st for Appendix J?
May 31st.
May. Okay, I just wanted to clarify that either I heard it wrong or it was stated wrong and we weren't under a 20-some day deadline here. I guess on Appendix J, it does seem very complicated. The options that we have, I appreciate Carl's staff giving us options, but it does seem like, in terms of making it more less convoluted and more user-friendly, it would be better if we just had one set that applied to the city. If we shore up the community benefits and can roll that out, it seems like I could get behind just letting the appendix sunset. But one thing that might be helpful in the next presentation would be what that actually looks like. Obviously, I'm not going to have a 5-story building going next to me where there is a ranch housing and residential zoning right now. So that's not going to be changed if that sunsets. But like a visual map of, what exactly, the color codes that you had in there, like if Appendix J drops, where all are we talking about in the city having this reverting to the standard height limit? Where all does that apply? If that makes sense? Mm-hmm. Right now we've got all those different bubbles of, option 1, 2, and 3, and then just another option of if we let it lapse, where all are we looking? Because I think a lot of the areas will not be included because they are residential, if I'm following the map correctly. So that would be helpful. And then, in terms of opting individual neighborhoods out, like Gun Barrel or somewhere, I would be uncomfortable with like carving out really specific pockets because that just doesn't seem like very good governance in terms of opting out and carving out. And that's part of why I think I favor just overall eliminating Appendix J. And if I heard you correctly, it sounds like maybe Gun Barrel gets extra protections because they also have this county layer of review. Maybe I heard that backwards, but if so, then that makes me a little bit more comfortable about Gun Barrel's level of review. And I also wanted to ask, I know we've only been at this a year plus or something, but with the affordable housing being eligible for the extra 2 stories, last time I asked, there had been no applications for that. Have there yet been any applications for getting those extra stories on affordable housing?
Planning board just Planning board just approved 100 units of permanently affordable housing at the former Rally Rally Fitness at near 29th and Bluff, and that'll be coming before council for call up here soon. So that was our first one.
So we've had one. That's good. I guess my point there is that I'm not super worried about it being like abused and the floodgates open. If we do it well, I think it should be more of a steady drip of people who actually use this, because it should be giving us a community benefit. So we do want the affordable housing, and we do want the affordable commercial space and art space and human services space. So I understand that we don't want to, sort of give the farm away, but we do want to create a program that people opt into. So we don't want to have a de facto 35-foot limit because we've made it too difficult to utilize any form of this program. And then on cash in lieu, I guess my sense on the housing side is that sometimes you are getting more bang for your buck, as I think Mary mentioned, when you can bundle together and use it differently rather than on site. So I would not want to toss out the possible benefits of what the cash in lieu could bring. I could see a situation where if I'm paying 75% of the premier new building, that's going to still be more than if the city were able to have a pot of money that was giving me 25% off, somewhere else that was more affordable to rent. So I would hate for us to toss that aside without really seeing what the benefits could be in terms of a cash in lieu program. I understand it's new and we have to look through it, but and I understand the concerns about abuse, but I don't think that's a reason not to do something. Like, we can put up the guardrails and not throw out the baby with the bathwater. So I think those are my thoughts. Thanks.
Thank you, Rachel. Bob, and then I'll go.
Okay. I like Adam's idea, first of all, about poking some holes in this and trying to find out where the gaps are. I think this is a good start. I just think that we need to kind of think through, put ourselves into the shoes of a prospective developer and see where his incentives or their incentives might be to go certain directions. So let's just make sure that this delivers to us what we want. I mean, what we want is either permanently affordable residential or below market commercial, and let's just make sure that's what we're getting. We're not looking for a payment of money. We're looking for these things. So let's make sure that our desires and the developers' incentives are aligned. With respect to, I want to back up a little bit because as I think both Aaron and Sam pointed out, first of all, it's not Appendix J that we're talking about. We're talking about a moratorium. Appendix J is the exception to the moratorium. The moratorium was put in place in 2015 with the promise that, as Sam correctly pointed out, that there would be a community benefits codification. Because up to that point in time, even though these projects all had to go through site review, neither the planning board nor council had really a roadmap for which to apply community benefits. And so it was kind of subjective. And so a lot of stuff was getting approved. And so the prior councils kind of didn't trust themselves. So they said, you know what, we're going to prevent ourselves from approving something until we have some criteria by which to approve it. And so they imposed, that council in 2015 imposed upon itself a moratorium with the exceptions carved out in Exhibit J, saying that give us 12 to 15 months or 18 months and we'll figure out what the community benefits are. Well, unfortunately, 12 to 18 months turned into 6 years. I think, Tom, we've actually extended it 3 times since I've been on council. And each time we come back and say, well, we need another year or so, we need another year or so. So here we are 6 years later and we're almost there, which is great. My goal would be to actually to lift the moratorium. I don't know if we're going to make May 31. We may need to extend it a little bit. But I think if these are really the things that we want, it should be citywide. If there are parts of town or certain zoning districts where we don't want these things, then we should flip this over and have an appendix that says you can't ask for these things in these zoning districts or these parts of town. I don't know what that is, somebody can come up with that list. But if these are really things that we want, then it should be citywide. If these are not things we want, I don't know why we're having this discussion. So let's get what we want, and then let's apply it citywide, subject to another appendix, which would be the exception appendix, if there is one. But it's not Appendix J that's terminating, it's the moratorium that's terminating. I agree with some prior comments that trying to extend the moratorium indefinitely, first of all, it doesn't keep faith with what we said back in 2015. And secondly, making an Appendix J that's really, really, really long. Every time we extend this moratorium, we add to Appendix J on the laundry list proposed by staff. If we kept the moratorium is just, I mean, I appreciate the work they put into it, but it's Swiss cheese with more holes than there is cheese. And so let's just get rid of the moratorium when we're ready. It may not be May. And if there are exceptions that people want to exclude buildings between 35 and 55, notwithstanding the community benefits we'd get, then let's look at it from that perspective. I think that's the right way to approach it. And then finally, on the view protections, I agree with Aaron. This sounds like it sounds really clever and sounds really great. This seems like it's a years-long project. So I think Aaron's approach is right. Let's not include view protections in the site review criteria. I think the right time to look at view protections is on an area by area basis when we do area plans. And I think we did this a little bit of this with Alpine Balsam. Didn't we back up across Broadway and say, what views are we wanting to protect? So let's do that when we get to an area plan rather than trying to do it citywide, because I get to see that all sorts of rabbit holes being fallen into. And I just see a situation where we're going to have a lot of disagreements in the community about whose park or whose corner or whose backyard we need to be looking up at the mountains from. So I wouldn't even go down this path at this point in time. That's my feedback on that. Thanks.
All right, Bob. Well, thank you all. I will go down the questions first as well. I do generally support the staff proposal. I think you've done great work. I mean, as we heard from Kaiser Marston, this is not being done everywhere. So we are kind of plowing new ground here. And I think our motivations are the right motivations. And I think that we are approaching a way to address a problem in our community, which is that whether they're nonprofits or arts or startup businesses that otherwise have difficulty raising money, we would like space for them in our community. And I am not as concerned as Adam and Bob and others are about gaming the system, though I do think it's well worth taking Adam's suggestion and trying to poke holes in it. And one reason for that, and I think this is where it will be interesting to have some developers speak about this is going to be a relatively small space if it's on site in a larger project. And so it is not going to affect the cash flows, even if we told them they had to make it free, right? If it's 2,500 square feet in a 100,000 square foot project or something of that nature, it's going to be a matter of it's not going to affect their cash flow in a negative way. And then all they have to do is figure out how to manage the issue. So I think we should try and poke holes in it, but I think it's going to be easier typically for a developer just to follow through on what we're asking for than to fight it really hard. I also like the idea of in commercial buildings, if we're getting a contribution to affordable housing from the linkage fee that applies to the entire project. I think we have hit the requirement of helping affordable housing and mitigating the demand that's created by that space. And I would like to take staff suggestion about having the additional bonus community benefit be only commercial. So I like the idea in 2A of it being commercial. And I really like Mary's concept of trying to think of other things to do with the in lieu payment. So if there is an in lieu, and I agree completely with Junie that the first option should be that it's on site. If there's some reason we need to legally to have an in lieu payment and or there are cases where it's just going to be hard for the developer, I think we should be creative about what to do with that in lieu money. Now, if there's a way to lever it through government, other tax credits, or the way we do with affordable housing, fantastic. if there's not, I think we should be creative with things like tenant finish. So TI or tenant finish, I think would be an interesting way to have a grant program that ties into the affordable commercial. Off ramps, that gets back into the gaming the system kind of thing. I don't really like off ramps, but if the off ramp is that they have to pay the entire in lieu, and we do have an in lieu program in place, then if they can't do it in a certain amount of time, I guess that's okay. And then Appendix J, I just want to say, put our minds back in 2015. Commercial buildings were favored over residential buildings because they weren't providing community benefit. And that's what the Pearl West project showed in spades. And we have beaten that horse to death, but that's why we launched down this path, is because there were developments occurring in different parts of the city, which were getting all the benefit of additional intensity, and we're not paying anything back to the community for that additional intensity. And I feel like once we now have the commercial linkage fee in place and set to a rational amount, and are going to add on affordable commercial, I feel like we have done what we said we were going to do. I would lift Appendix J entirely. I don't want to muck around with a whole other layer of development review requirements that are going to be complicated unnecessarily, because I don't think they're going to get us much more. So I'm pretty much where Aaron is on this, and Bob, that the whole point of moratorium was so that we would get things in place which would get us the community benefit as benefit recapture. So I would lift Appendix J entirely. I'd get rid of the moratorium. And I don't think there's any way to do a good view protection ordinance. If there were skyscrapers, there might be a point to that conversation here, but I really just don't think that would be a good use of our time. If we're going to put a bunch of planning time into something, I think there's a lot better things that we could do with that. And then on to the site plan review criteria. I just want to, everything Mary said about dwelling units per land area, I think we should have all that in our sites for modifying in a way that gets us smaller units that are affordable as opposed to bigger units, which are unaffordable and for the wealthy. I also agree with Mary about keeping the comp plan referenced in the site plan review criteria. Now, there are creative ways to do that because there are many, many policies in the comp plan, as Carl pointed out, that really don't have anything to do with the development and the way that we're talking about in site plan review. So I think narrowing that focus would be good. So I agree with the narrowing the focus. And one thing that Mary and I talked about earlier, thinking through this, was it could be that specifically policies that have not been implemented in code, because we make comp plan policy changes and then it takes some years to actually make their way into our development review criteria. So you could reference the comp plan policies to be interpreted at site plan review that have not yet made their way into code. So I think that's it. I guess I want to say thank you for working on this so hard. It is a novel program, and I think it's one that addresses a community need. With that, we've got a bunch more hands. Mary, let me check the order here real quick because that doesn't do it. We got Mary, Rachel, and Aaron. Mary?
Thanks, Sam. And yeah, I just wanted to go ahead and weigh in again on Appendix J. Now that I've had my memory refreshed on what it was, why we did it, and what we said we would do once we did the community benefit. So I would be in favor of, after we get these community benefit ordinances in place, to go ahead and lift it. I also agree with Rachel about just pointing out what that would look like. And however staff comes up with, that is a fairly straightforward way to illustrate that. I think that could be helpful to the community. I think it's important to do what we said we were going to do. And then with respect to the view corridor, I agree with Bob and Aaron that that's probably something that's better done at the area plan level rather than trying to come up with one view corridor ordinance that covers the whole city. So just wanted to make sure I weighed in on those two things. Thank you.
Thank you, Mary. Rachel?
Real quick, should I make a motion to extend the meeting?
Sure, please do.
So moved. And
is there a second?
Second.
All right. Anyone object to extending the meeting for a few more minutes? Seeing none, it's extended. Thank you, Rachel.
So I just wondered, like, I was putting myself in staff's shoes a little bit and like walking away from this meeting and being like, well, I'm not 100% sure what to do with the Appendix J, in preparation for the planning board and May meeting. So I didn't know if maybe it would be helpful to do straw polls on that or the view protection, because some of us didn't speak to it, or if maybe that's a silly idea, but just wanted to make sure we were giving staff whatever they needed on this.
I will turn to staff and say, do you need a straw poll? Have you heard enough? What would help you better to take the next steps? Carl? Carl's?
I think if
Okay, we'll do a straw poll then. Aaron, would you like to comment before the straw poll?
Sure. Yeah, I'm going to endanger my conciseness award here. I just realized there was one more thing that I hadn't said, which was I really appreciated staff about you bringing up the open space for dwelling unit requirements, because those I've had my eye on those for many years, and they do incentivize larger units over smaller ones, which then inevitably end up more expensive. So I fully support you bringing back revisions to that so that we could encourage smaller, cheaper units. So that's it. And I'm fine with straw poll like that.
Okay, we'll do a straw poll when we're done commenting. Bob?
I'm just want to frame the straw poll in the correct fashion. The question that we should be asking is, do we want to let the moratorium go? Because if Appendix J goes away, there's no exceptions to the moratorium.
Right.
So just want to make sure that the question that we ask is, shall the moratorium expire at some point in time, not shall Exhibit J go away at some point in time.
Yeah.
That Bob, you had to correct me twice on it, and learning.
No, I think Bob is correct. We would, and I bet staff would interpret it that way too, but we'll try and ask the straw poll correctly here. So no more comments. So we'll take a straw poll. Who would be in favor of letting the height moratorium expire, which would obviate the need for Appendix J, if we get the community benefits that are being discussed tonight in place by the end of May? Who would be in favor of lifting the moratorium if we put these community benefit requirements in place?
Can I just amend that, Sam, to when we put them in place? So it might not be May, but just
yes, when we put them in place
together.
Yes. I count 1, 2, 3, 4, 5, 6, 7. And who would oppose? I see Mark and Mirabai. So there's a straw poll for what it's worth. And Rachel's amendment, I think I would agree with that. If we don't have the community benefits definition done, I would not want to lift the moratorium. Bob.
I'd like to ask staff the question. Now that we've done that, I'd like to ask staff the question. So we've given you a lot tonight, and I suspect we won't be able to get this done by the end of May, which is fine. And so what we would need to do is we would need to extend the moratorium a little bit longer. My question to staff is, how much longer would you like, and don't say 12 to 18 months, to get this done? Is this something you think you get done by end of June, end of July? What time frame would you like? So that
my hope is certainly to complete it in that timeline, June or July. We've been working on this for a while, and I think we're making a lot of progress. And I think we've gotten a lot of good feedback tonight that can help us kind of zero in a little bit more. And I think that's probably enough time.
Yeah, I think this has been really helpful. I wouldn't think past August we would need to extend it.
So I might suggest that's helpful, guys. So I might suggest that Tom comes back with a slight extension to whatever staff wants sometime in the summer, and that we pass that sometime in the next couple of weeks, maybe even on consent. that extends the moratorium, take a little bit of pressure off of staff, but not too much pressure off of staff, so that we get this wrapped up sometime this summer.
Thank you, Bob. Aaron?
Yeah, a good idea, Bob. And I might just say, maybe we go to maybe to the end of July and just put it on consent. And since we've all agreed to it essentially here, and then if we need one more month, we could do one more month on another consent, but hopefully we wouldn't have to.
Well, Aaron, perhaps it would be best to just go to the end of August. That's 3 months. It's another 90 days. So that gives staff the flexibility of having July and a little slippage, because sometimes things slip over the summer.
That's fine.
So,
but it seems like we could put it on consent anyway, since we've talked it through tonight.
and I think first reading would have to be the first meeting in April, and second reading the second meeting, to have it in effect by May 31st because of the 30-day requirement. So we'll get something like that done.
Excellent. Thank you, Tom. Okay, so staff, do you have any more questions from us? Did you get what you needed?
I think so.
All right.
Thanks
Well,
very much. This has been incredibly helpful in getting us through the last piece of this. We look forward to coming back with something in ordinance form here.
awesome. Well, thanks to you all, as well as to Kaiser Marston. And I see Rachel has our closing comment.
I didn't weigh in on the view protection, so I will just say I support the comments that I think Bob and Aaron and maybe Sam all made on that one. I might be overstepping with Sam, but definitely Bob and Aaron. We didn't do a straw poll there.
Okay, very good. Thank you all very much. So with that, I think, Alicia, Adam.
Yeah, just council stuff real quick. I noticed we don't have any instructions or any game plan for going into our meetings on Thursday for boards and commissions. Who's going to ask questions? You know, we usually had like a little pre-meeting or something in regards to that. So if we're just going in at 5 o'clock and we're there, I have some concerns about how the process is going to go.
Well, I will say this. I will say that in the past, we have always just rolled the dice and somebody asked a question and then off we went with that. But the challenge we have, of course, is the restrictions that we've got on serial meetings and so on. So we could assign people to ask a question for each one of the boards. But I see suggestions from Bob and Rachel.
Well, I was going to raise the same point that Adam did. So Adam, thanks for raising that. And I do agree that assigning questions is a good idea. I don't care who asks what questions. I trust all of you guys. But what I've seen in past years is when questions are made up on the fly, sometimes they're not the best of questions. And so I would just say randomly, and I'm happy to let Alicia do this and pull names out of a hat tomorrow morning and just send notes to each of us and say, all right, Sam, you've got open space, and Mary, you've got planning board, and Bob, you got arts or whatever, and maybe it's 2 council members, because we usually can get 2 questions in, and have, so that way we come with thoughtful questions. Again, I don't care so much what the questions are, just as long as they're thoughtful. And I think if we're given a day or 2 to think about them, they're going to be a lot better than if they're made up on the fly during that kind of awkward silence when no one knows who to go. So I would be in favor of assigning questions to whomever.
Thank you, Bob. Rachel?
Yeah, I love that. And it feels equitable too, if Alicia's pulling it out of a hat and it's just, Bob, you have a question for these 4 boards, and Adam has these 4 boards, because with 2 members and a gazillion boards, we'll have more than 1 question each. But that it did feel awkward last year and a little bit inequitable, that like you couldn't tell if your question was going to make it through, or if nobody was going to have a question. That felt awkward. So I really like and support Bob's idea.
Adam?
Last thing I'll say, I'll offer up that the third question of how many of these board and commission meetings you've attended takes about 2 seconds to answer, and I think it provides a whole lot of information in that 2 seconds. So if that might be a standard question, I would appreciate it.
Junie?
Oh, thank you. I was just thinking last year, I thought we did get the questions from, I'm not sure, from council, from your office, Alicia. So I'm not sure if I'm happy to make up questions for 4 different boards, and the meeting would be on Thursday. So if I could get the questions already made up, that would be much better, much more helpful. And I think it probably would be more efficient as well. Better questions, as Bob mentioned.
Aaron?
Just if we're going to ask people how many meetings we've attended, we have to make sure that we've confirmed that they do have viewable meetings on the internet. We ended up with an accidental gotcha question last year because of that.
Good point.
Rachel.
It was a little bit fun, but I think maybe I understood this a little differently than Junie did for what Alicia would be doing. I was just thinking Alicia would tell us there are a number of, you will make up questions for these boards because council members made up questions. The candidates were asked questions in the written format, but then in the oral interviews, we asked, as I recall, 2 questions total. And so I wasn't thinking that Alicia would have to make up those questions, but it sounds like there's a difference in opinion here. So just thought we should talk through that too.
Alicia.
I just wanted to say it's my understanding that no, we don't have any idea what the questions are. It's my understanding that the council members made those questions up, but I'll be happy to do a random selection to assign the boards and commissions to each council member, just so you'll have time to think of those questions.
That would be super helpful. And I agree that we should have 2 questions per board. And so if you wanted to pick 2 council members for each board and commission and get a list out to us with that. Adam, to your point, I would suggest that we only ask that question if they were televised so that we avoid the gotcha point. So we can go through and make a mark, or Alicia, you can tell us which boards have publicly viewable meetings, so online or television. And is everyone happy with that? 2 questions. We usually say, introduce yourself and, say a couple of words, and then question 1, go around, question 2, go around. And then for the right ones, we ask Adam's lightning question. Is everybody good with that? Rachel.
I'm sorry if I just missed this, but it might be easier. Like last time it seemed like one council member was in charge and then we changed who was in charge, each new interview group that came through.
We do that, yes.
I just wonder on Zoom, like things are so clunky. Is it better if you just take charge?
I serve at the will of council. So however folks would like it, I'm happy to ask questions or to introduce folks and then turn to council members to ask questions. Is that your suggestion?
It is my suggestion that just one person, does the intro stuff. And so we're not going down the line the way we did, because that just seems like it's going to get, I don't know.
Yeah,
I agree. It's
Zooms
easier in
are
person.
clunky enough already. Yeah. Good.
Okay. Very good. Mary?
I was just going to agree with that.
Okay.
Usually when we hand it off to a different person, it's in the changeover. There's not going to be much of a changeover.
Right. Okay. In that case, I will just do the introductions. Hi. We're going to ask you all 2 questions. You can go around and say your names. Rachel's got the first question. Aaron's got the second question. Okay. Very good. I appreciate that thoughtfulness. That's very helpful. Okay. Any other wrap up? Chris, staff, anyone?
One more suggestion. If we could, in the introduction, I'm wondering how people feel about, one of the things that we talk about with boards and commissions is how we have not done a good job of onboarding and making sure that people, as they get on boards, that they understand what their role is. And so maybe as part of the introductory piece that Sam would make at the beginning would be to say, make sure that folks understand that should they be appointed to a board, that they become public officials and then have to abide by what a public official takes an oath to do. So just a little bit of trying to open up the door to a more deeper onboarding process.
Super. Rachel.
One more do we need to ask any boards any specific conflict of interest questions that may apply for projects coming up? And do we want to tee that up, or will Tom tee that up at specific boards?
Tom, do you have any thoughts?
I won't be there, but I would suggest that you consider whether for planning board, anybody who's working for CU, considering CU South's in the pipeline and going to be crucial in the coming months.
Isn't conflicts a standard question in all the applications or most of the applications?
It is.
It is, but although I don't know it calls out any specific, specific employers in town. And would that also apply to OSBT or just planning?
Well, planning is the one that has 3, and then it'll be 2 people conflicted out right now. So it would be helpful if whoever you add, it doesn't have a conflict.
Okay. I think so. It might be helpful to ask that question, at least for that board, Sam.
Mm-hmm. So ask the question, do you work or have any professional relationship with CU for planning board? Is that what you meant, Rachel?
Yeah, just employment or conflict with CU, I think, for people applying to planning board would make sense. Unless Tom would advise different language.
No, that's fine.
Okay, very good. I'll do that. I think it's also worth asking open space as well, just so we know for what it's worth. Junie.
Yeah, I'm slightly concerned about having to draft the questions, especially that we just had a discussion about not having gotcha questions, and I don't know what could be considered a gotcha question, because if I'm writing questions and I bring them on Thursday, and that's the first time, I guess, you've heard of it, and that's probably the first time the candidate as well will have heard of that question. And if it's a question where they stumble on, then how do I know the difference? Because at the end of the day, there's no formalities on how to draft those questions.
So Junie, I was the one who said a gotcha question. It was something very specific, which was, we asked how many meetings that you had attended. And as it turned out, there were meetings that were not televised, and people said that they had watched them. So it was just, that was a very specific, like, kind of tricking them to see if they were, and generally any kind of question you would ask about a board's purview is fine, I think.
Thank you.
And I would maybe add, if anybody doesn't have time, I assume we can just call anybody up and say, do you want 2 extra questions, right? Like, nobody has to draft them. Probably you can. Sam's nodding. Sam will take them.
I was going to suggest that very thing before we were done with this, which is if you get picked for a question that you don't want to ask because you don't know what the board does very well, or you think somebody would be better for it, as long as council agrees, I think you could just reach out to another council member and say, could you ask this question, or trade with them? I mean, I think all that really matters is that we get the questions thought of ahead of time. I think that's the key point here. So horse trading, I think, is fine with individual council members unless people object. All right, we'll start out. Alicia will give us our assignments. If you don't like your assignment, see if you can barter with another council member. And then there was one other. Oh, Bob will not be present for a few of these. So Bob, do you want to tell all of council what your restrictions are so that Alicia doesn't give you a question where you won't be there?
Yeah, I'll be late on Thursday night. So I'll be there for the second half around, I don't know, 6:45 or so. So it'd be better if I had questions for whatever's the second session. I'll be there all night Tuesday, and then Thursday kind of depends on how late you all go. I have the same conflict every Thursday night, so I'll be available around 6:30 or 6:45. But based on the schedule, it looks like you might be done by then. So, but second half of Thursday night.
Very good. So you will be gone the second half of Thursday.
I'll be gone the first half. I'll be available.
First half. Okay.
I'll be gone the first half of Thursday night, but available all of Tuesday.
And you've got that, Alicia, right?
Yes. I'll just give in questions on Tuesday. No.
Perfect. No, that's right. That's right. You can do that. All right. Any other issues, council or staff Going once, going twice, seeing none, I'll gavel this meeting closed at 11:35. See you all in 2 days.
Thank you.
All right, good night, everyone.
Night.
Bye.
Take care.